Good morning. Welcome to day 2 of the Joint Labor, Health, and Social Services Committee. It's June 21st, the longest day of the year. And we're in Pinedale.
Yeah.
For day 2. First up this morning, welcome to the people online as well. We do have an update, which is apparently statutorily mandated that we get from the Department of Health on the Community Service Block Grant. So I'm hoping they're online this morning. Mr. Fuchs, if you are, and turn on your camera. You're missing a gorgeous day in Pinedale, but we're happy to have you remote in. And we'll just give the Department of Health about 30 seconds to get their camera on.
Supposed to be an awesome full moon tonight too.
Dykestal? And there's Mr. Fuchs. Whoever wants the floor, take it away.
Good morning, Mr. Chairman, committee members, Stephanie Sandoval. I'm the Senior Administrator of the Public Health Division with the Wyoming Department of Health. And as you mentioned, this update to the Legislative Committee is statutorily mandated. And I'm not sure, we're having some technical difficulties. So you can clearly see I'm not Mr. Dirk Dykestal. However, Keith Harris, our Rural and Frontier Health Unit Manager, will be giving this update, and I believe he's online as well. So if we could admit him, I will gladly turn things over to him for the update.
He seems to be having some technical updates as well. So while that's getting figured out, maybe because Mr. Fuchs is online, we always like just general updates from the Department of Health, how things are going, how they're being implemented. I know we are working on some research this committee asked for our August meeting when it comes to federal grant pass-through. And so we'll be reviewing that information that's apparently still being compiled at our August meeting in line with this committee's wishes in Star Valley. And now that I've stalled long enough, I believe we're good to go. So again, the floor is yours.
Mr. Chairman and members of the committee, this is Keith Harris. Can you hear me okay?
No, but let's check with PBS to see if we can amplify it. It's not us, it's you. Can you amplify yourself just a little bit more?
Absolutely.
Perfect. You are good to
Okay,
go.
can you hear me now?
Yes, just like a 2004 Verizon commercial.
Excellent. Well, good morning, Mr. Chairman and members of the committee. I'm Keith Harris, and I represent the Rural and Frontier Health Unit within the Wyoming Department of Health. And I want to thank you for this opportunity to update the committee on the progress of the Community Services Block Grant, also known as the CSBG. This is an update since the last briefing that was given to this committee back in 2021. The CSBG is federally funded, administered by the Office of Community Services within the Department of Health and Human Services, and it is designed to assist states and local communities. It works through a network of public and private designated eligible entities to combat the causes and conditions of poverty, revitalize low-income communities, and empower low-income families and individuals to become fully self-sufficient. The Wyoming Department of Health, Public Health Division, Rural and Frontier Health Unit is designated to administer this grant in Wyoming. This grant specifically serves Wyoming residents who are at or below the 200% federal poverty level, which is set by the U.S. Department of Health and Human Services. Our current federal allocation is $3.7 million, and it serves all 23 counties and both tribes in different capacities based on their poverty rating. No match is required, and no state funds are allocated to this program. The state of Wyoming acts as a pass-through for this grant, providing funding, technical assistance, and support. 90% of these funds go directly to local services through 12 eligible entities, while 5% is retained for discretionary activities, and the remaining 5% for the state's administration of the grant. Local funding distributions are made by tripartite boards to ensure equal community representation. Boards consist of a third elected public officials, 1/3 representatives of low-income individuals who reside in the communities the community served, and the last third can come from the community at large, such as from business, industry, education, or law enforcement. This grant serves roughly 1,000 Wyoming residents annually, focusing on supporting senior citizens, people with disabilities, education, and health. Services provided include housing, energy assistance, nutrition, employment, childcare, and emergency shelter. Impacts are measured through client outcomes, as all services are tracked and measured against national performance standards. All of our state data is reported in an annual report, which is provided to the Office of Community Services within the U.S. Department of Health and Human Services. We have found that Wyoming has observed numerous beneficial outcomes from this program. For an example, 2,649 individuals received case management services. 2,201 individuals avoided eviction. 247 adults and youth have increased their education and learning skills. 196 individuals with disabilities or chronic illness maintained independent living situations, and 862 individuals avoided eviction or foreclosure. And I'd like to share a recent success story that involves the use of CSBG funds. We recently had one client who had lost everything as a result of an apartment fire in which she resided. The loss included losing all of the tools and resources that she needed to perform her primary job. However, being a part of the CSBG program and getting CSBG funds, she was able to receive temporary shelter and promptly had her work supplies replaced, enabling a swift recovery. And lastly, we've made significant progress in our state administration of the CSBG program. Technological advancements have enhanced our data collection methods, improved our risk assessments, and made our monitoring processes much more efficient. Mr. Chairman, this concludes my update. I stand for any questions.
Committee, any questions? The Department of Health? I do. Oh, go ahead, Representative Penn.
Thank you, Mr. Chairman. So this, it sounds like this originates from the U.S. Department of Health and Human Services, administered by our Wyoming Department of Health. I guess I'm just a little not sure of the list of things that it was given to housing, employment, all these things. Doesn't sound so much health related as maybe other, I guess that's, I'm not sure if this is the right department. Have we changed in our focus? Did it start out that we have always been addressing these issues with this money, or have we creeped in a different direction?
Mr. Harris, if you know.
Thank you, Mr. Chairman and Representative. Appreciate the question. Yes, this program has always been about combating the causes of and the conditions of poverty, and helping to revitalize low-income communities and empower low-income families. Because in these categories, they found if support is given in these areas and people can become more self-sufficient, it keeps them healthier.
Okay. Mr. Harris, before I turn over to Representative Clouston, does the legislature get a copy of this report as well? You said you send it to the feds every year. Is there also a copy turned over to LSO or someone on this committee? Do you know?
Mr. Chairman, I am not aware of that, but I'll be happy to research this and get back with the committee.
You do love paperwork. With that, Representative Clouston, you have a question?
Thank you, Mr. Chair. Thank you, Mr. Harris. My question was similar to the chairman's. If you could please, I was trying to write down some of the statistics that you sent us.
Yes.
If you could please send us what you were reading there, so we'd have those. And then also a link where we could maybe look further into this, please.
Mr. Chairman, Representative, I would be
Go ahead.
happy to provide that. There is lots of statistics from year to year. And that is also annotated in our annual reports, and I will make sure that a copy is provided.
Ms. Sandoval, you want to jump in?
Yes, Mr. Chairman and committee members, I just wanted to make the committee aware that this program, the Community Services Block Grant, does have a health stat report that the committee receives on an annual basis, in addition to our statutorily required presentation to the committee. So just for awareness, that health stat document is provided annually to the legislature, and we'll be happy to follow up with the remarks from Mr. Harris today as well.
Appreciated. Senator Dockstader has a question.
Thank you, Mr. Harris. You referenced one situation where there was a fire, went back in and helped reestablish this individual. How do these cases end up in front of you? How do they get to your desk? Because it seems like there would be endless opportunities across the state. How do you refine them? How do you decide who is assisted?
Mr. Harris.
Thank you, Mr. Chairman and Representative. How do we track success? That is a great question. There is a federal standard that's passed down to the states called the Results-Oriented Management and Accountability System, or ROMA. It's a results-oriented approach to reducing the effects of poverty, avoiding eviction, and building self-efficiency. These programs are passed down to the county level as we realize that each county, their assessments and their needs are different. And so through these eligible entities, they know their counties, and they at the local level determine what's best for them and how they are going to go about using these funds, and then they report back to the state level.
Follow up, Senator Dockstader.
That's really quick. Then I think what you're telling me is a case ends up in front of you as it comes through a county level position, right?
Mr. Harris.
Mr. Chairman, Representative, yes, that is correct. Through these eligible entities who we have communication with on a regular reoccurring basis, they report to us their needs and their cases and outline to us how they would best like to use their resources and their funding. So we don't dictate that, they just report to us.
Additional questions, Representative Penn.
Thank you, Mr. Chairman. Maybe I missed it and you already listed them, but could you tell us what are the eligible entities? I'm just wondering if these are elected people or appointed people or what? Thank you.
Mr. Harris, at the county level, who gets the money and where does it go?
Mr. Chairman, Representative, thank you for that question. Yes, the eligible entities have to be made up of approved boards, and those boards are dictated how they are comprised. Each board of our eligible entities, and we have 12 eligible entities throughout the state of Wyoming. So many of these boards serve multiple counties, but the boards must consist of a third elected public officials, a third of low-income individuals who reside in the community served, and a third at large from either businesses, industry, education, religion, law enforcement. So there's flexibility in that last third.
Help us out. Is there like a name for this entity? Is it just called the Community Services Board in each locality?
Mr. Chairman, each of the eligible entities do have specific names that they've come up with. We collectively just call them eligible entities. But for an example, if I were to give you some of the names of some of these eligible entities, we have the Community Action of Laramie County. We have the Community Action Partnership of Natrona County. We have Goshen Help. We have High Country Behavioral Health. We have 122 in Teton County. So there are a myriad of names depending on what they've come up with at the local level.
Thank you. That certainly helped me out. Now I got it all in the right place in my mind. Other questions, committee? Not seeing any Mr. Harris. Anyone else from the Department of Health while we, oh, hi, Senator Hutchings. You can have the floor. Go ahead.
Thank you, Mr. Chair. And Mr. Harris, this is a lot of money coming to the state of Wyoming to disperse to communities and sovereign nations. I can only imagine where the money's coming from. But how does an individual, number one, find out about this this type of help? And what if you know are any strings that the federal government has attached to us receiving this money? What does Wyoming have to do on behalf of the federal government? Thank you.
Thank you.
Mr.
Mr. Harris,
Chairman.
go ahead.
Thank you, Mr. Chairman. Senator Hutchings, appreciate that question. The answer to the first part of your question about the entities themselves, the entities are responsible for their marketing, their advertising within their jurisdictions. So it is a little different for each of them, how they go about doing that. They do have collaboration, they share and they swap ideas, but that is done at the local level. As far as strings attached, there are deliverables, yes, that must be met. The biggest deliverable is on a quarterly basis, tracking information through this ROMA, the results-oriented management accountability system. We have to follow their system, report numbers, and then do an annual report that is pretty extensive, outlining exactly how the money was spent, what were the outcomes. And so there is a tail, and we at the state level have the staff to support that.
Thank you.
Any other questions, committee? I'm not seeing any at this time. While I have all the Department of Health, anything else for this meeting while we have you here? Not seeing anything. Certainly appreciate you spending your morning with us from Cheyenne. That looks like the state capitol behind Miss Sandoval in the background. All right. Miss Duncan, some thoughts on this subject? Go ahead.
Thank you, Mr. Chairman. Shelley Duncan, representing myself. And I'm actually a part of WYO Help, which was formerly Goshen Help. And the CSBG grants, what they do is they're actually reimbursable. So it's not just free money. You have to account for it. You also have each of them are required auditing. They're required lots and extensive reporting. And so what happens is that it's a 2-year funding. So it sounds like a big number, but it goes over 2 years. The other thing is that, for example, for ours, there was Goshen Help originally, and then after that, there were several other counties that didn't have anyone when COVID funds hit and or CARES funds hit, and we had the rent fund assistance and things, those different kinds of funds that were available, and there was no one in Carbon, Niobrara, Weston, Crook, and then most recently we added Washakie. But those counties didn't have anyone that had the facilities or the capability to actually disperse funds and to track and monitor and all that for the CARES funds. So that's when Goshen Help expanded to WYO Help. So what happens is that people come in, we have food pantries in Rollins, and we have a food pantry in Torrington. They have rental assistance, they have medical assistance where someone needs a ride, or if they need help with prescriptions or whatever. So there's a whole thing, but each of the boards in your different communities have local autonomy. So this funding comes in, and then the local people get to decide, what's our focus? Do we want to focus on housing? Do we want to focus on food? Do we, what do we want to focus on? So it's very rigorous in terms of all the reporting and tracking and everything. And then what I've discovered recently is that our community has to put up like 90 days worth of our own funds before we get reimbursed. So it's not just a blank check.
Questions are you still a city council?
Mr. Chair?
I'm
ahead.
now officially a Lingle, Wyoming City Councilman.
Questions for the city councilman, Senator
Well,
Dockstader?
Councilwoman Duncan then. So when it was Goshen Help, was it funded any different way? Did the county step in and help at all?
Ms. Duncan?
Mr. Chairman, no. There's a lot of things that the funds that most of these entities receive are not enough to be sustainable by themselves. They still have staff in some of the places, and there are some restrictions on these grants for like salaries and things like that some of these grants don't allow. So they have to rely on donations and other types of grants and things that they apply for. But it's basically all of these entities that they were talking about, they're charities, local charities.
Thank you. All right, committee. Thank you for jumping up in there. Seeing no other people raising their hand on this topic, we'll move on and jump into our favorite topic, our number one interim topic, childcare and maternity care follow-up. LSO, do you want to kick us off from where we were from the last meeting to where we are now to where we're going?
Mr. Chairman, would you like to hear from Emily Wangan or me on my memo first? What would you prefer?
I mean, I enjoy hearing from both of you, but I think it would be great if we welcome back Emily, who is now officially our intern after formerly working for us with the hope that she might come back and work for us again. But currently she's our summer intern. So Ms. Wangan, welcome. The floor is yours to present that information. But your microphone's not on yet.
Can you hear me now?
We can hear you now.
Perfect. Thank you, Mr. Chairman. Sorry about that. Thank you guys for having me back. It's been wonderful to be back in Cheyenne and at the Capitol. So I have two memos for you today for the child care and maternity care follow-up topic. Mr. Chairman, would you like me to discuss nannies or support for rural obstetrics first?
We'd like to go with nannies first, please.
Sounds good. So this memo is item number 1001 in your packets. And this responds to a request for a bill draft to increase the number of families that nannies can serve in Wyoming. So research revealed that there are no requirements for nannies in the Wyoming statutes or agency rules. And so this memo just identifies different sections in the statutes that may need to be amended to create requirements for nannies or other childcare providers. So Wyoming statute 144102 provides for the type of childcare that are exempt from licensing requirements, and this would include nannies under the section of person employed to come to the home of the child's parent or guardian. I also looked at other provisions within the statute that discuss other types of childcare. There is one exemption for daycare facilities providing care to the children of only one immediate family unit. And so another possibility that could limit childcare providers would be local zoning codes. They could limit the in-home operations if the home is zoned as residential property. I gave an example of Du Bois, Wyoming in their town code. They do not permit operating a trade or business in the home without a special use permit. And so with that, I went through that pretty fast, but I would stand for any questions.
So ultimately, there isn't anything from the state level, either in rule or reg or statute, because we heard from some people from that area. And so when the research, I'm just trying to summarize this for my thoughts, came back that it was really more of a local zoning issue. And so this committee could decide to put something statutorily in place for the whole state. We could certainly encourage the department to do some rules and regs. But otherwise, this is really being handled through local control through either municipality ordinance or through zoning. Would that be the overall content of your testimony?
Yes, Mr. Chairman, partly. I would also refer to the exempt childcare facilities that are exempt from licensing requirements. That might be something that the committee would wish to look at.
Any questions, committee? Anyone online? Not seeing any on that memo, Emily, so let's go to the next one.
All right, thank you, Mr. Chairman. So this next memo is item 1002 in your materials. And this was response to a request for more information on cross-training and additional certifications that providers could obtain to support rural obstetrics services in Wyoming. So on the issue of cross-training programs, that allows healthcare providers to gain additional knowledge and skills in different specialties. However, this is mostly done by individual employers that conduct these programs in their own staff, so there's minimal involvement in state cross-training programs. But another part of the request was to look at certification programs for providers. And so bottom of page 1, going on to page 2, I just outlined a few programs from national organizations that came up a lot when I was researching this topic and have been recognized by a national rural health advocacy group. So you can see those on page 2. And then I next looked at other states' approaches and how they support rural obstetrics in their states. States generally use financial incentives to support rural obstetric services, but I did find one interesting program that's discussed on page 3 of the memo of the Simulation in South Dakota program. And so that is the Department of Health partnered with some healthcare facilities in the state to create a mobile training facility that would travel to different rural hospitals and use simulated patients to help train doctors in a variety of different situations, such as deliveries and obstetric emergencies. Then the rest of page 3 and the top of page 4 of the memo just discusses some loan repayment programs in Nebraska and Utah. And then finally, at the bottom of page 4, I discussed a little bit of federal programs, which are grants that state and local governments are eligible for. The first one, the National Health Service Corps program, Wyoming participates in, and funding is given to Wyoming through the Wyoming Office of Rural Health. And with that, I would stand for any questions.
So committee, maybe I should have kicked this topic off just a little better to remind us where we were and where we're going. At our last meeting, as many of you remember, and I know many people in the audience were here, but perhaps there's some new ones online today. We were discussing the shortage of OBGYNs in Wyoming and what the possibility was of either how do we get more of those specialty physicians into the state or associated practitioners. And then the issue came, if we can't fully get a practitioner, can we cross-train with some of our family doctors or family physicians or medical professionals in the community to get additional credentials or additional training that they would still be kind of the family physician, but perhaps they could also engage in labor and delivery services, especially in our most rural places where it doesn't make sense to have, what is it? You need 3 maternity doctors on staff for the 24-hour, cycle. And so that was really the genesis of that memo, is what other states do. Can we do some type of training program for our existing physicians, nurse practitioners, PAs, et cetera, to get additional training or certification? Because this is all wrapped up, as many of you in the audience are aware, in malpractice rates, insurance, on certifying these people to be able to successfully deliver and be with that child in the first couple of days. I should have kicked it off that way. So the committee, with all that information, questions on Emily's memo on perhaps what we could do to either incentivize or find other certifications for our providers in this area. Their Representative Ward.
Thank you, Mr. Chairman. So it's not a question, but a comment rather. The problem, and I tried to express this last time, the problem that I see is that the obstetricians don't want to work with midwives. Midwives operate out of fear. They'll drop clients because they're afraid of getting sued. They don't have rights in hospitals. And so I think we would cover this area better if we empowered midwives and if obstetricians would work with midwives in a collaborative relationship instead of an adversarial one. And that's the kind of thing I'd like to see us enable by reducing regulations and tort reform. So I'm not sure that this memo addresses that, but those are the types of things I'd like to see.
It is difficult sometimes to make everyone play nice, unless you require it by statute, right? I agree, right? We have a whole lot of options we could and should be pursuing, just trying to get off the ground and find a couple that work best for Wyoming.
Mr. Chairman,
Yep, Senator Doxter.
you've been with this committee a long time. Seems like we ventured down this road before and it never got any traction. We didn't get anything done, but we explored it. Do you recall the history on that?
I do not, Senator Doxter. I am new to this committee this term, and while I've been in the legislature for a long time, I perhaps did not focus on labor health issues as long as I should have. Senator Baldwin or Representative Yin, I know you've had some longer tenure than I have.
Yeah, Mr. Chairman, we have touched, particularly on tort reform, we've touched deeply. It's been a while since we've done that, but we spent a lot of time talking about tort reform. We did make some changes. I don't know that we gained a lot of ground, but we did make some changes. Concerning OB in general, midwives, the adversarial relationship that Representative Ward talked about, we've discussed it, but we've never made, as far as I can recall in my time, which seems like forever on this committee, that we've made any significant progress in that realm, nor I don't believe that perhaps Representative Yin can refresh my memory, but I don't think we've actually had any legislation that addressed that realm.
Representative Yin.
Mr. Chairman, thank you. As far as I recall, I don't remember. So my first session in the legislature, I was in labor health, and I don't recall us passing anything in that relation.
Okay. And at the end of your memo, Emily, you do mention MAT Care, the maternity care program that does establish accredited nurse midwifery programs to train nurses to increase maternal and perinatal health workforce in rural and underserved communities. And so I don't know if there's additional information for our next meeting you could find, but I think I certainly would be pleased to get more information on the MAT Care program you briefly mentioned there in that paragraph. If you want to do some more research, or our LSO staff could. It does seem like there's a program to help get midwives in rural areas that can be certified or trained. Senator Baldwin.
I would add to that, Mr. Chairman, that perhaps we can talk with the Wyoming Medical Society. Maybe they could do a survey, or they could get us, as well as the Wyoming Nurses Association, get us some information on the attitudes and the things that they feel like are happening in that field.
Other questions for Emily? Yep, or go ahead, Representative Ward.
Thank you, Mr. Chairman. Perhaps we could get the obstetricians or somebody representing the obstetricians to tell us or share with us why they're reluctant to work with midwives.
Certainly could invite some at our next meeting. If they're not busy working, to try to get them here. Representative Yin?
Mr. Chairman, I'm trying to recall the discussion that happened at our last meeting. What I would also like to see is a midwife who feels like they have not been able to work with an obstetrician or a delivery room, just to figure out what they see as their specific concerns coming from a midwife themselves as well.
I don't know. So Katie or LSO staff, we could contact the board. Certainly, as we heard yesterday, it's our smallest licensed board in the state, but see if there's got to be one somewhere near Laramie County who could attend our next meeting, I'm certain, even if it's online. Speaking, before I get Emily off the hot seat, anything else? All right, thank you. Ms. Wingen, good to see you again, and hopefully see you all summer long. And then back here working as a full attorney here in a couple of years.
Thank you.
We do segue right. You're welcome. We're segueing right into a memo from Ms. Johnson then on midwives. If that works, Anna, take it away.
Thank you, Mr. Chairman. I wrote a memo for the committee regarding midwifery licensure and programs. The committee had requested information regarding midwifery educational programs. This memo describes the requirements for midwife licensure in Wyoming, as well as midwifery programs at the University of Colorado, the Midwives College of Utah, the University of Utah, and Montana State University. Midwives in Wyoming are required to either graduate from a midwifery education program or have 5 years experience practicing as a licensed or certified midwife in another state. Midwives must be certified by the North American Registry of Midwives and must complete a practicum. Notably, the Wyoming Board of Midwifery does not require a person to have a nursing degree or diploma in order to be licensed as a midwife. They can be licensed as a midwife through practical experience as well, in that for the previous 5 years, they've attended at least 55 home births and have held a certified professional midwife certification. On page 2, the University of Colorado College of Nursing has 3 midwifery programs. A student can earn a Master's of Science in Nurse Midwifery, a Doctor of Nursing Practice in Nurse Midwifery, or a postgraduate certificate in Nurse Midwifery. Notably, the University of Colorado also offers a rural midwifery track, where the track provides financial support in the form of scholarships and stipends to students accepted into that program. And actually, the money that they give them is pretty generous. I believe it's like a $30,000 stipend per year, as well as tuition. Students are required to work in rural healthcare for 2 years after graduation. The Midwives College of Utah offers undergraduate, graduate, and continuing education courses in midwifery. The bachelor's degree is anticipated to take 4 years, and students work through coursework including birth observer, assistant midwife, and primary midwife under supervision until they can handle births on their own. The Master's of Science in Midwifery program provides coursework in research methodologies, professional development topics, critical studies in midwifery care, and field work. The continuing education course provides academic and clinical training on a variety of topics for maternal and infant health providers. The University of Utah College of Nursing Nurse Midwifery program offers a nurse midwifery track, a women's health nurse practitioner track, and a doctoral degree in nurse midwifery. There is also an option of completing a dual nurse midwifery and women's health nurse practitioner specialty by going to school for an additional semester. And then Montana State University has a nurse midwifery program that is set to begin this fall. Applicants are required to have a bachelor's degree in nursing, and the program will focus on rural access to maternal and postpartum health care. Students will be allowed to do most of their coursework online, but will be required to attend a certain number of births. The program is the first of its kind in Montana. And with that, I would stand for any questions.
Questions on all the information Anna just mentioned? I guess ultimately the question is, for Wyoming, we have programs in our surrounding states. Do we, for these type of programs, do you know if we allow, let's say, workforce development training funds or any type of reimbursement for our current providers to be able to attend these programs and have, I'm sure they have financial incentive like all other programs, but is there anything in Wyoming we know of that would, we can incentivize, subsidize, any kind of eyes, these programs?
Mr. Chairman, in my research, I didn't come across anything in Wyoming in particular.
So I'm just thinking, committee, if there's any kind of legislation we want drafted for our next meeting along these lines, we should probably be requesting it now. I've been getting text messages nonstop that we will get a variety and plethora of medical professionals at our Cheyenne meeting. They are listening right now, and they are lining people up to come talk to us. So go ahead, Representative Penn.
Thank you, Mr. Chairman. Looking back at the previous memo and kind of going with this one as well, I was just thinking about the loan repayment program. It's on page 3, and thinking how at this point, you know, we have WWAMI. We do loan repayment for WWAMI. Is there something that we could do? And I'm not sure that this needs to be legislation even, but just kind of brainstorming to further incentivize this specialty within WWAMI that better encourages our WWAMI students to specialize in OBGYN. We're already covering some of their tuition, most of their tuition. is there a way that we can incentivize this tract?
I mean, Anna, thoughts off the top of your head? Is it this, it's a similar training and certification as perhaps other, I don't want to call it career tech, but it is a specialty that we have to be able in some way, shape or form, be able to incentivize or encourage. Thoughts?
I think Mr. Chairman and Representative Penn, we don't, as far as I can tell, have a midwife program either at UW or at the community colleges. So we would probably have to incentivize them to either get their education elsewhere. But like I said, midwives in Wyoming aren't required to graduate from an educational program. They can just be certified through training, like on the job, basically. So there may be ways to incentivize that in the state, just financially, like a stipend or something.
We certainly wouldn't want to disincentivize any by making it, you know, overly rigorous. They have to go back for additional training, but I guess at the appropriate time, when after some public comment, when we're thinking about bill draft ideas, we can certainly take that up. Other questions? Go ahead,
Mr.
Dr.
Chairman, if we build draft, let's refine what we're trying to fix here. I recall last meeting, we're saying we've got a shortage of OBGYNs out across the state. Are we trying to fill that gap with midwives? I'm a little concerned about the part where I hear no education is needed, just practical experience. What are we trying to do with this piece of legislation?
I mean, I think overall, the goal of this topic in this committee right now is to try to encourage and increase the number of professionals to meet the need when it comes to delivery and care. So if that's more OBGYNs, more specialized training for family practice docs, more midwives, it's really whatever we can do to solve the care shortage. So yeah, certainly don't want to see anybody less trained, although I would, yeah, I was just going to say the more births someone has been through, I imagine they on the job training comes pretty far there. Go ahead, Representative Ward.
Thank you, Mr. Chairman and Senator. I would like to respond to the training comment, just to clarify the kind of training that midwives go through. The knowledge that they obtain is often more extensive than obstetricians. Obstetricians are taught in the medical model. So when problems arise, they're taught, let's do a C-section. There are many births that midwives know how to attend that an obstetrician wouldn't know how to deliver. For example, a frank breech, meaning when the buttocks present first instead of the head. Most obstetricians will do a C-section in that case, but midwives are trained how to deliver even a footling breech baby. And obstetricians, the only tool in their toolbox is a C-section. So I just want you to be aware that midwives have a lot of training, maybe not medical training as you're saying, but they have a lot of applicable training and their knowledge is generally more extensive or can be than obstetricians.
So LSO or Representative Ward, there are certified midwives and then there are, I guess I'd say non-certified midwives but to be a certified midwife, you have to be a member of the board and go through the credentialing process. But certainly there are other midwives in the state who assist in these efforts who aren't part of the board and the certification. Would that be your understanding as well?
Thank you, Mr. Chairman. I'm not as familiar with how the situation works. I know there are CPM certified professional midwives in Wyoming, and they don't need a medical degree, but they have a lot of practical experience and practice that's required of them before they can become a CPM. Certified nurse midwives are required to have medical training. But my point is that the CPMs get a lot of knowledge and training that is not offered in the other tracks.
So overall, Senator Dockstader, that's the mission. I mean, we're working on with the legislature, I don't think we're going to have a direct subsidy to try to encourage more, let's say, OBGYNs. I mean, I just don't think the legislature as a whole would go for that. and some type of subsidy, would they go for some kind of reimbursement or heightened program above and beyond what we have for our physicians through WWAMI? I'm not sure, but that gets dangerous if you start specializing, which professions we need more and will we encourage more of. So it's still a brainstorming game on how we
Right.
solve this problem.
Mr. Chairman, we're a little early. I don't know if you would allow if somebody is on from the medical society that could step in and comment on this.
Sure. We're gonna go to Ripton of Clouston. He's a member of the medical community. Go ahead, Ripton Clouston. Come on up.
Thank you, Mr. Chairman. Just something I'd like some more information on. Are any of our hospitals or facilities hiring midwives? And then also, what's the liability insurance like for a midwife? Just making sure that, they're carrying insurance in case something goes wrong to make sure our patients are covered.
You're jumping on this, Senator Baldwin? Go ahead.
I'm jumping. Yeah, and just to answer one of those questions, and I can't tell you about the malpractice insurance, that I honestly don't know, but we do have Wyoming hospitals that do employ midwives. It's across the state, not even. Some places do, some places don't, and certainly an area we could use some improvement, but we do have midwives practicing in Wyoming.
I'm gonna jump to public comment real fast. Welcome. Floor is yours. Senator Hutchins, did you have a question? We can get to you first.
Yeah, I
Go
did.
ahead.
No flies in the house. My question was kind of like this whole conversation. We were told that there is an OBGYN desert, and I don't know, I can't remember who came in and said it. And now we're all concerned that we're not able to deliver babies in Wyoming because there's no one to do it. I would like to get more information on whether that's true. Who in the community is suffering, or in our state, what counties are suffering from a lack of OBGYNs? Can we get numbers, statistics, something, and also information on the midwives? It seems like if they're out there and if there's several, maybe there is no problem. Maybe there is no desert. We were just told there was, without really a lot of information. So that's where I am. I'm listening to a lot of chatter, but I don't know what the facts are. Thank you, Mr. Chairman.
Thank you. We're going to streamline some of that chatter as we keep moving forward, because there's some people here I think will continue to give some information. Go ahead, sir. Floor is yours.
Thank you, Mr. Chairman. My name is Dr. Ben Moritz. I'm the Executive Director of the Community College Commission. And it had been requested that we do some research and come present to you on midwifery programs. So this seemed, I raised my hand, this seemed like an appropriate time to come up. The memo that was provided by LSO is extremely helpful, and thank you for that. The programs laid out in the memo that was just discussed are surrounding states, and they are all either at the bachelor's level or beyond, and they all require the nursing certification as well. We did some research. There are no midwifery programs at the community colleges right now. However, there is a precedent for associate level midwifery programs that lead to the CPM, the Certified Professional Midwife. These programs involve some nursing coursework, but primarily they focus on the midwifery practice and a significant amount of clinical time with other midwives observing births, being involved. It's close to 1,000 hours as far as some of the leading programs are. For your reference, one of the technical colleges in Wisconsin kind of leads the way on this. I believe it's Southwest Wisconsin Technical College. They have a 2-year program, an Associate of Science degree. If there was a interest in looking for loan repayment or incentivizing or other isings of these. One thing that comes to mind is we do have the Wyoming Investment in Nursing loan repayment program that could apply perhaps. This is hypothetical at this point, but to midwifery programs if an associate's degree that led to a certified professional midwife program was launched at any of the community colleges. All of the community colleges have robust nursing programs. They are all in alignment with UW's nursing. So it's a 2+2 program leading to a Bachelor of Science in Nursing. Additional coursework would be necessary in order to stand up a midwifery associate's degree. Presumably that would not be a 2+2, but that would just be a terminal degree leading to that CPM. At least that's how it's been done in the state of Wisconsin and a couple other areas as well. I believe maybe Kentucky.
And a 2+2 program for those of us not in academia, or 2 years at a community college and 2 years at UW?
That is correct, Mr. Chairman. Thank you.
Representative Ward, go ahead.
Thank you, Mr. Chairman. I'm encouraged by your comments about the associate program with entry into CPM. Is there anything that stops us in Wyoming from offering that type of program at our community colleges?
Go ahead, Ms. Moret.
Mr. Chairman, Representative Ward, thank you. There is not, other than the fact that it does not exist right now. Looking at the midwifery licensure board, typically how these types of programs work is that the design of the program is done in coordination with that licensing board, so that at the end of those 2 years, not only do you receive that Associate of Science degree, but you are trained specifically for any licensing exams or anything like that that the licensing board may have. And so that would avoid the need for the full bachelor's degree of nursing or any graduate work. It would create, it would lead to professionals with that CPM, assuming that that is the type of workforce that you're looking for. The community colleges would be able to stand that up. We would just need to start working with both the licensing board and the colleges themselves to find who is interested in moving forward on that, and then work on that curriculum.
And maybe could you just give us a quick overview of how a new program would be developed? It's based on a need, it's based on a request, and then maybe the due diligence of looking at the population, the need. I don't know if you could give us a 1-minute overview of that process. So if we initiated a request or an encouragement to review it, what would that look like in the timeline?
Sure, Mr. Chairman, thank you. Any new program that is proposed by the colleges first starts internally. Faculty work to identify what that curriculum would look like. They reach out to industry to find out what those specific skill sets are. In this case, they would reach out to the midwifery community and probably the nursing board and other medical professionals. That would then go through their internal processes and ultimately have to be approved by their board of trustees. The board of trustees at that college is going to look at the fiscal sustainability of that program. And to that end, those faculty and the academic folks at the college are going to say, this is the anticipated need. This is how many people we think will be enrolled. This is the overall cost for additional resources or faculty. And this is why we think it will pencil out at the end based on the need that we're projecting. Once it's approved by the Board of Trustees, it then comes to the commission and we review it. We bring in all of the other college academic VPs as well as the presidents, and they sign off on it as well. We are also looking to make sure that there's fiscal sustainability or viability. And once it's approved, we're really getting a timeline, I think. Typically, a new program from brainchild to approval by the commission is going to take at least 8 months, possibly 9. And then if there are additional hires that need to be made, that goes from there.
Thanks. While we have you, any other thoughts on, I mean, certainly every college couldn't have, maybe the question is, let's say we did want to create a program. What is the competition, I guess is maybe the right word. How do you decide where to place that? We certainly wouldn't have 8 programs. We'd probably have it at one community college with some transfer work. How does that get decided?
Sure. Mr. Chairman, thank you. We definitely would not want to have this replicated across the entire state. There just wouldn't be enough demand to justify the additional hires, because there would no doubt need to be midwifery specialty in a new instructor, something like that. As far as how that's selected, we are a coordinating body. We're not a governing body, so we don't get to choose. We do have a very good council of academics from all of the colleges. They get together. Most likely they would discuss it. I'm guessing the way this would roll out is that 1 or 2 colleges may show a little bit of interest. They would talk amongst themselves, identify who had the best resources, who was best positioned to move forward. That one would move forward, and then the other colleges would step back, but at the same time support and send any referrals to that particular college.
Go ahead, Representative Ward.
Thank you, Mr. Chairman. I just wanted to offer that I'm willing to be involved in this conversation if you think it would be helpful. I'm not a midwife. I'm a doula who's obtained or been at 60+ births. So I have some knowledge. I don't practice medicine, to be clear. That's out of the scope of practice for a doula, but I have interest in this topic. And so if you thought it'd be helpful, I'd love to be involved.
Mr. Chairman, Representative Ward, we would love to have any input that we could. And we would definitely, or the college is interested, would definitely want to make sure and, tap any expertise that we have in the community. So thank you for that offer. I'm sure we'll take you up on that.
Real quick, do all of our community colleges have sonography programs? And not that it's a 1-to-1, but I'm just thinking there are some certain techniques and tools and people who I don't know why I would think they're a little more coordinated. If there's an existing sonography program, that might be your same populace. Are they in all 8 colleges or just a couple?
Mr. Chairman, they are not. That's one of those specialized areas where it just doesn't kind of pencil out to have there's additional technology needs for those sonography programs. And so and when I say it's a market-driven issue. If 1 or 2 of the colleges have that program stood up, another college is not going to say, we want to invest $2 million of our very limited resources to compete with you in a small state that we're already in. It's not welding. Welding, we definitely have 8 different programs because we are turning out a lot of welders. We would start with 1, and then as there was additional demand, I'm sure others would say, we'd like to get into that area as well.
Okay, President Penn.
Thank you, Mr. Chairman. I was in the memo that we've been provided, and I'm not sure if you have this, but there's the Midwives College of Utah. There's Montana State University, which is a nurse midwifery program. University of Utah has that as well. Once again, thinking about what structures do we already have in place, and then looking at other models that we've used for medical training with our WWAMI program. So we have partnership with, the University of Washington. We have the WICHE program, which, partners with University of Utah already. We have a nurse practitioner program at UW already. So are there ways, and I know that your community college, I'm kind of just speaking, but one of these was a midwife college in Utah. Is there a way that we can look at partnerships either with community colleges, if this one in Utah is a community college that we could partnership where they already have curriculum, they already have a program in place that we could then kind of partner with them. In Utah, where I went to nursing school, there's the Weber State program, and they have outreach in various places. Even in Wyoming for a time, they had outreach from Weber State University, and you can attend classes in Wyoming or at Utah State or all these other satellite things. Is there something that we could coordinate or look into that way so we can take a program that already exists, borrow some of their ideas, or even just borrow their program and bring it to Wyoming so that our Wyoming students have easier access?
Dr. Moritz.
Mr. Chairman, Representative Penn, thank you. There are several items kind of nested in that question, I think. The community colleges do create 2+2s with out-of-state institutions. For instance, several of the colleges work with Chadron State on certain programs, particularly in the northeast side of the state. On the western side of the state, they do work with Utah universities as well. The Utah College for Midwifery is I believe, a private institution, and that doesn't keep us from doing a 2+2, but we definitely could do that. As far as any sort of nurse midwifery programs, those all would require that bachelor's level, and so that would really be out of the scope of the community colleges. That would be more of a UW question, I think. But if UW was interested in standing that up, I'm sure they would work with our nursing programs. The nursing programs across the state at the 8 colleges and the university are one of the tightest aligned disciplines in the state. Those 2+2s have to be rock solid in order to get to those nursing credentials. So they could do something like that, or they could partner with one of these out-of-state entities. As far as borrowing the curriculum, I think the 2-year certified nurse practitioner is enough of a difference from these nurse practitioner programs that if we wanted to look to borrow or partner with, we really need to look at another community college CNP type of situation, such as the one in Wisconsin. I believe there's also some in, I don't remember if it's Kentucky or Tennessee, but a little further afield. Does that answer your question?
Okay. Other questions for the Community College Commission while we have them? Thank you for coming up to Pinedale. Don't go too far just in case.
Okay, thank you.
Ms. Davis? Bet it's time to have you jump into the conversation. Welcome, Executive Branch. Floor is yours.
Good morning, committee. Jen Davis from the Governor's Office, Health and Human Service Policy Advisor. Thank you so much for having this discussion. This is a really important issue in Wyoming, as you all heard in the last committee meeting. I'm not sure if you all remember, but as part of the Governor's Health Task Force, we have an OB subcommittee. We recently combined that with our primary care subcommittee, since this is a bigger issue of just OBGYNs doing this care. And so that subcommittee has been meeting regularly, discussing everything that you're talking about here today, and digging in a little bit deeper on these topics. We have a really robust group. We have 3 or 4 OB physicians on the group. We have some midwives on the group, nurse practitioners, a whole variety. We have the university on. And so what we're really trying to do is look at a lot of these issues and the underlying issues for this. So unfortunately, it is a super complicated topic in Wyoming, just like all of rural medicine. And so I think there's some things that we really need to ensure that we're looking at as we're having these conversations of, I think midwives definitely have a place to play in this conversation, as well as doulas, as well as OBGYN, as well as family practice. However, we need to have some coordination in that effort. As Representative Ward has pointed out, midwives are not going to be able to practice at the top of their scope if there are not physicians who are willing to assist them at the hospital level if there is a problem with the birth. And so there are a lot of issues that make this really complicated. And I know that Mrs. Bush has surveyed the physicians and asked just to get a better sense of what family practice physicians are actually doing deliveries in Wyoming, so that we have a better sense outside of just OBGYN. What are the other family practice physicians doing? There is also a split between the family practice physicians who deliver and OBGYN. So again, anything medical, we get into territorial spaces of what that looks like. and how we best all work together. And it's definitely solvable for sure, but we just need to have those meaningful conversations with each other about how do we meet the needs of our Wyoming citizens. And to Senator Hutchings' comment earlier, Department of Health, when they speak, will be sharing that information again that they shared last meeting about the deserts that we have. We do have the data. They presented it last time and they're happy to share that again today. For a perfect example, we know that the Rollins Hospital in the Sublette County, or not Sublette, Lincoln County, both lost their OB/GYN services and no longer do deliveries. So we know those are some definite locations that we are not having those services. Many of those are going to other counties for delivery, and some outside of the state for delivery. So again, I think this is a really big issue. It's really complicated. The subcommittee has also been looking at what other rural states are doing to address this. We had a presentation from Alaska a few weeks ago in the subcommittee about how they have addressed rural OB/GYN care. And they're using a lot of midwives to do that. They have regionalized their services, not saying that's the Wyoming solution, but just hearing what other states are doing, particularly rural, about how to address this, because we simply do not have enough OB/GYNs across the nation. It's not just a Wyoming issue. And so how do we ensure that women have safe deliveries, and not only a safe delivery, but then you now have a newborn. Do we have the pediatricians and the family docs to take that care on after delivery? To the question about midwives in hospitals in Wyoming, Powell Valley is doing an amazing job with their OB care in Wyoming. Is that something we need to look at and replicate? So there's a lot of things that we can do in this space. I just think we need to be real intentional as we do this, because if you do one thing, it has an impact on others. And so as we look at the dynamics around this whole issue, I think it's really important as we look at building educational programs, as we look at doing loan repayment programs. To Senator Dockstedter's comment, what is it that we're trying to do here? And how do we best do that so that we meet the needs of our individuals while giving all of those professions a space to do that effectively and efficiently? So just wanted to share with you all that OB committee is doing a lot of work and digging in a lot on that. And I don't want to speak for Mrs. Bush on everything that she's done in getting information, but we're also looking at fellowship, possibly in the state of Wyoming for OB. And that's another way that maybe we can meet some of this demand. But again, that's another complicated issue that needs some time to sort out.
So thanks for all that. We're having the same issues in the legislative branch. So, I mean, ultimately the question is, by our next meeting, is there anything coming from the executive branch to say, here's what we would like the legislature to look at? And if so, will that be in the next 60 days?
Chairman Zwanitzer, that is a great question. I know that right now the big discussion is around the fellowship program. Is that something that we could do with our UW family practice? So that is being looked at right now to see if there is appetite to be able to do that through, particularly one of the issues that we have to look at is the number of births. In order to be competent in these skills, you need to have a number of births that you actually get to participate in. And so by creating a fellowship with even the small numbers that we have in Laramie County, if you did it there, if you did it in Casper, where we have our 2 residency programs, what does that impact does that have on the other residents in the program? Do they then not get any access to labor and delivery? So that's a discussion that we're having right now with the physicians, the 2 UW practices. And as far as more details on that, I would have to defer to Mrs. Bush on that. So that might be something that comes forward to look at as a real opportunity for some sustainability.
So that's maybe you'll bring us some proposals. We're not sure. And we can do that. I mean, the topics are number one priority. We have struggled, as you're well aware, on some concrete definitive things that we believe we can put out, for the 2025 session that'll make a dent and really increase care and help alleviate some of these issues. And it sounds like, you have all the right people on your side as well who are going through it and struggling to find a way forward. I guess one of us has to, the question ultimately is, and if you don't think it's going to be there, that's fine. I'm trying to figure out how I can structure our committee meetings, that if there are some asks, I can have them prepped for our August meeting. And if not, we always could have a half day or 1 day online meeting later in the year. But I'm ultimately asking, do you think we'll have some things that are concrete, or is this still a whole lot more investigation and brain power, and might be another year of this committee's work?
Chairman Zawanitzer, to be real honest, I don't know. I don't know that we'll have something concrete. Like I said, it's complicated. And when you start talking about one thing, it pushes the balloon out on the other side. And so I think we have to be real conscientious of what we're doing. I know Department of Health, you'll be hearing from here in a little bit, and has maybe some thoughts about something that could be done in a short term that's an easier lift than, some of these complicated pieces that we have now. So to transparently answer your question, I don't know. I think that this is going to be an ongoing discussion probably into the next year. It's complicated, and we just simply don't have the amount of practitioners in Wyoming that we need in this space, regardless of whether it's midwives, OBs, family practice. We have a shortage in all. So this is a big topic. But I also get your point. We don't want this to linger on because it's a real issue for women in our state. So I think we all have a lot of work to do in the short term, and see if we can get something for you guys by next time.
Thanks. If only we had a healthcare authority to think about these issues. Hey, Representative Clouston, floor is yours.
Thank you, Mr. Chairman, and thank you, Ms. Davis. So we do have the governor's healthcare task force. What kind of things have they done to address, this important topic for Wyoming? It's hard to recruit people to Wyoming when we don't have good healthcare and a good system when we have these shortages to deliver babies and take care of the babies and moms. So what ideas do we have from the task force, and are they meeting on that? Are they going to have any special meetings? Do we have an OB task force?
Ms. Davis.
Chairman Zawanitzer, Representative Clouston, yes, we do have an OB subcommittee of the task force that is combined with the primary care subcommittee, so that we're having a comprehensive conversation about how primary care plays into this as well. Right now, the recommendation, as I mentioned, that we're focusing on is fellowship is one of the things that we're talking about, and also the conversation about how to integrate midwives more intentionally into care in Wyoming, looking at what Powell Valley is doing and how that could potentially be replicated, and what they've done to be successful in that model. So those are some of the two primary things. The other conversation that we're having, which I'll tell you is not a popular one, but it's one we're having because it needs to be done, is the discussion of regionalization of those services. Do you somehow do regional birthing centers so that you're driving patients to one area where you could have a concentration of providers to do this work? Again, not the most popular option because it requires people to travel. But unfortunately, it's some of our reality that we're seeing now. So those are the three big things that are being discussed in that work group presently.
And thank you, Ms. Davis, Mr. Chairman. When will that subcommittee task force be meeting again?
Ms. Davis.
Chairman Zawanitzer, Representative Clouston, we are meeting again in a couple of weeks, the beginning of July. I can't remember the exact date, but we're meeting about every 2 to 4 weeks in that subcommittee, really trying to get some momentum and moving this forward.
And I don't know if you can tell Representative Clouston, but your video picture is about 25 feet up on the ceiling. And so every time we talk to you, it's like we're all looking up in church towards the heavens. It's kind of fun to watch the whole audience gaze up as a committee chairman here. Other questions for Representative Penn?
Thank you, Mr. Chairman. I'm not sure if this is necessarily a comment for Ms. Davis or maybe actually really a research comment, but what she was saying made me think of this. So as has been brought up by Representative Ward, and some of our other discussions as well, one of the big issues is the agreement for physician oversight. So my question is, and again, this might be a topic of research for LSO, what are other states doing as far as requiring that physician oversight? And what I'm thinking of is, so as a nurse practitioner in Wyoming, I can practice independent of the physician, but physician's assistants cannot. You look at other states and that may be different. You may have PAs and NPs practicing independently in other states. You may have requirements in other states where PAs and NPs must have physician oversight. So how is our state different? Are there other states out there that do not require physician oversight for certified nurse midwives or, other midwives? So that if there's a way that we can kind of draw back, and I know that that's going to create a lot of turf wars and things that way. But what I see is, as we've discussed, we have a situation where we simply do not have the ability to provide for these women. And so we're talking about requiring women to drive hours in order to deliver, which unfortunately means we have babies in the car and we have situations like that because of the rural nature of our state. So we need to be really willing to open our eyes and be willing to look at how do we pull back some of this regulation that we've required and that we are requiring so that we can allow women access. Some people might be fearful that it isn't as good of access as they would, or good of care as they like. But as Representative Ward has said, some of that is just simply in the eye of the beholder. And when we're up against the wall, as we are with this topic, I think we need to really investigate how can we back off some of our regulation, still providing good care, but providing care. And that's where we're at right now. We aren't able to provide care in some circumstances.
Wouldn't you agree?
Chairman Zawanitzer, Representative Penn, from my understanding, and I am certainly not the expert in this, so midwives in Wyoming are autonomous. I think the issue is that if there becomes an issue where they need to transition a patient into the hospital, then they don't always necessarily have hospital privileges to do that. And that is then dependent on the physician. So from my understanding, the real issue that we have in this discussion that's been had in the OB subcommittee is that it is either hospital policy, which we don't have any control over, or it is simply physicians who don't want to take on that liability because they have not done the prenatal care. They don't know the patient. Maybe this patient is coming in where all of a sudden it's an emergency situation because something has gone wrong, say with a home delivery, and that they are reluctant to take on that liability. So again, I think this is a really in-depth conversation that needs to probably happen with physicians and midwives. And Representative Ward, your comment of bringing in physicians next time, we have had this conversation with midwives and physicians in the OB subcommittee. And it's very divided. And so do you add a regulation to force the issue of it to be done? Or is there another strategy? Again, I think what Powell Valley is doing is working well with midwives and physicians. And I think they'd probably be happy to speak to this committee about how they're doing it and how they're successfully doing it. So again, I think it's not an issue with our midwife scope of practice currently. I think it's an issue that goes beyond that.
Representative Ward. And then we'll come back to Senator Doxter. I keep looking to my left and not my right. Go ahead, Representative.
Thank you, Mr. Chairman. How would this kind of proposal work? Supposing we said, if you're a hospital and you accept any kind of taxpayer funds, federal or state, you will give admitting privileges to midwives. And combine that with tort reform. How would that work?
Go ahead.
Chairman Zawanitzer, Representative Ward, that's a great question. I think that, but just to be honest, I think what you will see is if you require that, then you still have to have the physician buy-in to do it. You could require the hospital maybe to give midwives privileges, but if it requires a surgical intervention, the surgeon still has to do that. If it requires a C-section, let's say, you still have to have the physician willing to do that. So I think just giving privilege to the midwife doesn't necessarily solve the issue. And I think that some physicians are simply not going to do this. And so I think what we might see is some physicians opting out of even doing the service for anybody in that area if they're required to do it. So again, I think that I wish there was an easy answer to this. It's super complicated. And as this committee knows probably better than any committee in the legislature, scope of practice stuff is always very touchy. And so how can we collectively solve this problem? And again, I'm sorry, I don't mean to beat the drum on Powell Valley, but they found a way to work through this with their hospital, with their midwives, with their physicians. And so maybe there's some good lessons learned there that we can all think about how we can do it collectively and make it work.
Senator Dockstader,
Thank you.
you've been waiting patiently.
Thank you, Mr. Chairman. This is both for you, Mr. Chairman, or our co-chairs, Ms. Davis. Who ultimately has authority over this subcommittee? It's the governor's task force. Does this task force, do you have a chairman of these subcommittees? And is it just the governor the answer to, or can we call for legislation for an end product?
Ms. Davis?
Chairman Zawanitzer, Senator Dockstader, it is a committee that the governor stood up just through executive order for the health task force. This is a subcommittee of just interested individuals. So there is a chairman lead. Myself and Mrs. Bush are currently leading this effort. We have legislative members on that. Your Chairman Baldwin participates in that fairly regularly. And the idea is to have legislative representatives on that so that as these issues come up and legislation is needed, that we're partnering together with the executive branch, the public, and the legislative branch to move these efforts forward. So that's kind of the idea of the health task force right now, is making sure it's a collaborative effort to bring you all something that, you know, needs to be done statutorily, or if it's something that maybe can be done through rules and regs through one of the agencies, we can tackle it through that avenue as well.
Mr. Chairman, is it realistic to call upon this subcommittee, acknowledging that my co-chair is there, to ask for a legislative recommendation within the year?
I think we can always ask.
Chairman
Is
Zawanitzer,
it
Senator
realistic?
Dockstader, you know, I think it is something, yeah, that you can definitely ask of that committee. I can't promise you that they'll come up with something real concrete for a piece of legislation. But I think that it would be, you know, the recommendation may come back as we need more time to figure this out. But I think it's certainly appropriate for you to ask for one, yes.
Okay, one more if I could. Mr. Co-Chair, embedded in all that is our lack of providers. And that's a big problem as we go across the state. Fellow legislator and I joined the University of Wyoming, went down to the Wasatch Front a couple of weeks ago, sat down with them and said, what can you do to help? And we put out requests, and we'll probably hear from the Medical Society and the Hospital Association. We put out requests and said, where do we need to put these providers? And we're still waiting on that. And I realize that's not an easy question, but allow them to define where we need to do them. Ms. Davis, is that part of our problem? If we look for an end piece of legislation, we still got to have a provider to go there. Not everybody's a Powell Valley or a St. John's or a Star Valley Health. We've got those situations that needed to be addressed. So if we call for a piece of legislation, is that having the number of providers, that's key to that solution?
Ms. Davis.
Chairman Zawanitzer, Senator Dockstetter, yes. I mean, I think when we talk about the issue of midwives and standing up a program at the community college or the university to produce more midwives, I don't know if that's our real issue. We might already have enough midwives, they just don't have access. I don't know the answer to that question. But I do know that if we stand up an educational program and produce more midwives, and we still have the issue of not enough physicians to be able to cover if something happens in the hospital, then it's still a problem. That even if we produced more, but we don't have the other parts of the infrastructure there with the other providers, we haven't really solved the problem. So the provider shortage is a big issue as well. Or again, we have a shortage of family practice and pediatricians. Okay, they were successful with the midwives and the physicians, but now we have a newborn and we don't have anybody in that community to care for the newborn. So again, it is a complicated picture of provider availability is definitely an issue.
Thank you.
We're gonna, well, co-chairman, go ahead. I'll go to Representative Young after that.
I'll just make mine very quick, and that is, I just wanted to clarify and talk about a couple of things. I know Representative Online asked about the next subcommittee meeting. It's on Monday, July the 1st, actually, at 10:30, we'll be meeting again. Secondly, I wanted to throw in the fact that dependent practitioners, PAs, as a matter of information, are independent practitioners as of 2 years ago. And that's an important note to make. Thirdly, it's not necessarily just a shortage of providers in these locations. And I will use pediatricians as a perfect example. To put a pediatrician in some rural communities with a hospital is not practical. When they only see a very few number of patients, most pediatricians don't want to go to that location. So we can't just simply plug a provider into that location if there's not enough patients, or an anesthesiologist or a PA or a nurse practitioner. So it's not just a shortage of practitioners. Sometimes it's a shortage of patients, that we don't have enough patients to keep those providers proficient, which is part of the reason why we lost OB in a couple of communities. To clarify again, it was South Lincoln, not North Lincoln, that lost OB. It was only the southern half of the county. But that being said, a piece of that was there just simply not enough deliveries. And a number of areas in the state face that problem. Be it a family practice, be it an OBGYN, be it whoever delivers those babies, it's difficult to have someone in those places if there's not enough deliveries to stay proficient. It's hard to have 3 providers or 3 doctors or 3 OBGYNs in a community that only delivers less than 80 deliveries a year. That's not enough to stay proficient. So there's a lot of nuances to this. It's not just simply a matter of getting enough providers. It's a matter of regionalization is one of those concepts to look at. And I think it's an important concept to look at. And I think it applies more than just OBGYN. I think it applies to a lot of other fields. Every hospital can't do everything. It's not possible. Every hospital in the world or every hospital in rural Wyoming can't have the most sophisticated machinery, just say MRI. It's very expensive. And it's not practical to think that everybody has that service across the state. And in that case, we have to regionalize those services. They may have to travel a little ways to get those things, but that makes more sense. And I just thought, I said I was going to be short and I wasn't, and I apologize. But those were important concepts. And I think, but mostly for Representative Clausen on Monday, July the 1st, we will be meeting at 10:30 a.m. for that subcommittee.
Representative Young.
Mr. Chairman, thank you. Ms. Davis, I'd be remiss not to bring up the conversation that happened at our last meeting with the Wyoming Medical Society and the Hospital Association, where they did, and hopefully I'm not mischaracterizing their testimony, where they did agree that a significant barrier to provider recruitment is actually the ambiguity in our abortion ban of what is an illegal abortion, as well as that pairing with the criminal penalty. Was there any specific talk in the OB subcommittee of reducing that ambiguity in statute that could help with provider recruitment?
Ms. Davis, if there is.
Chairman Zawanitzer, Representative Yen, when we did our survey, that did come up from a few areas that was an issue for their recruitment and retention of physicians. I will tell you, we have not had that discussion in the OB subcommittee. At this point, it's really been kind of more about the other issues that we've talked about today. But I do know that it has come up as a concern, but not any conversation of doing any legislative action to change that.
Okay. Other questions for the governor's office? Senator Dockstader.
One more. Is there a refined statement of what the end goal is? And you kind of said it about 10 minutes ago. What's the end target? Very refined.
Ms. Davis.
Chairman Zawanitzer, Senator Dockstader, I think everyone's end goal here is to ensure that women have access to delivery anywhere in the state of Wyoming. I should say a safe delivery anywhere in the state of Wyoming. I think is our true end goal. How we get there is not a one-piece solution. I think it's going to be many of things that we've talked about in this meeting today and more that we'll hear. But I think that is our target, is how do we ensure that people can have babies here? It's hard to grow an economy if we have a desert of OB care where you can't have a family. So again, I think it's really important and ties into our bigger conversation of economic stability for Wyoming and development.
Right. Looking for any other questions? Representative Senator Hutchins, did you have a question? Not seeing one now. Oh, yep, go ahead.
I don't have a question. It's more like a comment. A little frustration with the conversation in that we have people that choose to live all over our state, very rural state. And we have an office, the executive branch, that is saying, we want to make sure that every woman who wants to have a child can have someone deliver that child. And that's their goal. It just seems like it's not practical. As Senator Baldwin mentioned, we can't have MRIs in every hospital. We can't have a hospital in every community. We can't even have a Walmart in every community. How are we going to have a goal to make sure every point in Wyoming coordinate that a woman who happens to be pregnant is going to have a doctor or a midwife to deliver her baby? How is that practical? If someone can answer that question for me.
Ms. Davis.
Chairman Zawanitzer, Senator Hutchings, maybe there needs to be some clarity in my statement. I'm not saying that we have that in every locale. What I'm saying is that women in Wyoming who want to have a baby should know that there is somewhere that they can go within the state to have a healthy child, and whether that be that maybe they do have to travel a couple 100 miles in order to do that. If we regionalize that, so just for clarity, that's what I mean. I don't mean that everybody has it in their backyard, but that we have an intentional infrastructure in Wyoming so that they can have one. Or, you know, and maybe a regionalization conversation is a partnership with some of our entities across state lines. I don't know. I think that's a question that we have to have. The regionalization conversation, I think, is a big piece of the conversation that needs to be had, as Senator Baldwin alluded to, and what Alaska has done. What they've done is they've regionalized care to centers, and women have to travel hundreds of miles to be able to have a safe delivery. And they come in at 34, 36 weeks of their pregnancy and have a place to stay so that they can ensure a safe delivery. That might be something we really need to look at. And I think Alaska would be happy to come and share with this committee what they shared with the OB subcommittee of how they've done that. And again, I don't know that that's the solution for Wyoming, but I think it certainly has to be on the table for discussion because you're exactly right. We can't have everything in every community for everything. It's just not possible. We don't have enough people.
Representative Yin.
Mr. Chairman, I just want to say it is a priority for myself to make sure that everyone can raise a family in Wyoming. And I think maternity health care is important to that. So while it doesn't have to be in everyone's backyard, making sure that there's access to maternity care across Wyoming, even if it is on a more regionalized basis, is still important to me.
Additional questions for the Representative Penn?
Thank you, Mr. Chairman. I'll try to form this in, phrase this in the form of a question. So, Mrs. Davis, it seems to me that as we've been discussing here, several of our problems, and we don't have one problem, we have accumulation of multiple problems, but several of our problems seem to stem from concerns for liability. Our providers aren't coming because of concerns for liability because we don't have enough patients and therefore, they may not see as many patients. And ultimately what that means is they're not so comfortable taking care of this patient because if they make a mistake, they might get their pantsuit off. Or if a surgeon has to cover for an OB or for a midwife, or they do surgery on a patient that they didn't do prenatal care on, there might be liability involved. Several of these things come down to liability. I'm wondering if we want to talk about legislation and have something ready for this next meeting, we maybe need to be looking into tort reform. I know that other states recently have passed that. We can probably come up with some model legislation. That's maybe something that LSO can look into what other states are doing. But Ms. Davis, would you agree that liability is a big portion of our problem?
Go ahead, Ms. Davis.
Chairman Zawanit, sir, Representative Penn, in the conversations that we have had, yes, liability is a concern for many in many different areas and even beyond this OBGYN conversation as well of, how do people feel protected from lawsuits, especially when you're giving any kind of care. I think you all talked about another issue yesterday that has to do with liability as well. So it is an issue.
We're going to talk a little bit more about that after this discussion. Any other questions for the executive branch while I have her? Seeing none. Thank you much, Ms. Davis. Other people here to talk about maternity care access? Ms. Bush? Welcome.
Good morning. Mr. Chairman, members of the committee, Sheila Bush with the Wyoming Medical Society. I apologize for not being here early, but I was listening. I believe there were a couple of questions directed at the Medical Society, and I'm not certain I'm remembering those. I was driving. So I know one came from you, Senator Dockstader, if you could help me remember what that is. In terms of a presentation, I would just offer that we're really appreciative of the conversation. We think this is really important. I think the governor's subgroup or the task force with the subcommittee on OB and primary care is going to do a lot of heavy lifting on these complicated conversations and trying our best to bring some solutions and recommendations. I too can't promise that we will accomplish that, but we're working really hard in that effort. I will tell you sort of anecdotally, in my time with the Medical Society, I have not seen a committee get better physician interest and engagement than has this one so far. The last meeting I think we had almost 10 physicians, family physicians, obstetricians. And I think that that's really a testament to how important they believe this issue is and how committed our members are to trying and also addressing this problem. As was mentioned before, there are some natural tensions that live across the medical practice. Those tensions live within the physician community also, specialty to specialty. We have a lot to work through. Earlier, there were some comments about midwives. They're a really important component of this conversation. They are a key player in the team. I don't think it's wise to look to midwives to be the all-time fix. I don't think they can fix this problem alone, but they can fix this problem as part of the team. A couple of things I wanted to also mention. Ms. Davis did let you know that we have a survey out in the field. We're still collecting responses for that, so I don't have anything to present for you today, but hope to be able to have that in August. And we've asked questions. We have not asked the question, and it's not in the survey, about opinions of working with each other. I don't know if that was a miss. It's really more data centric, along with some sort of open comment opportunities that I'll be happy to summarize and present in August. I also am committed to bringing physicians to that August meeting. I think because it is in Cheyenne, I will have a better opportunity to bring some doctors to have some of these conversations. And so I would just ask between now and August if there's something specific that you would like us to have a physician present, or someone that a medical professional would be able to better offer. Let me know and I'll make sure that that happens. And with that, I'll stand for questions.
We did come to the community that doesn't yet have a full hospital in the state. That was an interesting choice. Questions for the Medical Society?
Mr. Chairman.
Go ahead, Senator Dockstader.
I won't worry about the earlier questions, but Ms. Bush, Representative Larson and I were with the University of Wyoming, went down to Salt Lake and trying to get a plan put together to provide more healthcare providers in the state. And Representative Larson and I are talking and with their authorities saying, okay, there's already some training. And then I sent a message out to you and to the Hospital Association. I think Representative Larson did as well, saying, what's the priority list? Where do we go with these? Should we magically be able to start to solve the solution and find some providers that believe in Wyoming? Where would we go with them first? And I know that's not an easy question. So if you and the Hospital Association could look into that a little deeper so we know what's our priority areas. I mentioned earlier, not everybody's a St. John's, a Star Valley Health, Powell Valley. I sit through my hospital board meetings locally and I hear they say, well, we need to plug a hole here in healthcare in a certain area. And I hear them actively go out and do that. And I see them, and next thing you know, we're putting a report in the paper and on the radio. Here's our new person. I don't know that we're getting that in other places across the state. So somewhere along the way, if you could kind of get us a list of where do we need to make sure that, as Representative Yen says, that we provide good health care in our areas. Maybe it's a regional approach, maybe not, but do we have an idea where we'd send these people if a miracle happened and we got some providers?
Ms. Bush.
Mr. Chairman, Senator Dockstader, thank you for the question. I have a couple of comments. The first is yes, I'm always committed to doing whatever you would ask of us, and so we will work on that. Initially, I would say, though, I think that there's some issues with identifying and coming up with a list that would say these 5 communities maybe are in the most need, and then coming up with some system by which you would force or even incentivize doctors to go there. I think you already have some programs that are federally funded that intend to do that with shortage areas and through HRSA and something I'm spacing on the name of right now. But I think there are some of those already in the works. What I would say too about medical student seats. So I know that when you had reached out to us about the question and prior to your visit to Utah, I think my response was, I think we have to have a really thoughtful conversation about whether or not we're already funding enough medical student seats. We may be where we need to be on those. And I think there's some merit in shifting the focus to elevating the residencies. There's quite a bit of data to support that physicians will ultimately put down roots and practice within, I think it's 150-mile radius of where they do their residency. Those same statistics don't exist for medical school. And so across the country, we have a shortage of rural residencies where, and maybe I've spoke about this to the committee before, so I'll try and be brief, but we do a beautiful job with WWAMI. We're very proud of the program. I think the 20 students is a really good number. We expanded to 20, I believe in 2018. I don't remember when we expanded to 20, but it hasn't, I think we're only at the first year of seeing the results of that increased class. So it takes a really long time from when the state decided to increase those seats. We're just now, I think, in the first year of seeing the results of that increased class. And so we might be wise to give that a little bit of time to see. And the reason I offer that is Montana, who has twice our population, they only have 30 seats in WWAMI, and we have 20 with half the population. And so it might be good to shift away from buying more medical student seats and really putting the focus on elevating our residency programs. They're wonderful programs. There's really good people there. As I mentioned, the United States is desperate for rural residency programs. We have residency programs in densely populated areas, and they get a lot of really good exposure to maybe more serious health conditions. You think Chicago, or, you're going to see a lot more trauma and those kinds of things. But if you graduate from a residency in a very densely populated area, there's a chance you didn't get as much hands-on training to do things that you're going to be asked to do when you practice in rural Wyoming. And so an example of that, this was years ago, there was a small community in Wyoming trying to recruit a pediatrician. And that pediatrician had graduated from the #1 medical school in the country, which, for primary care, which is Washington. They had gone to a very exclusive, wonderful residency program. They had the best training there was. And in the interview, it came up about intubation of infants. And it was a little bit of a stop because the facility said, well, that's you. And in their training program, there was an infrastructure around them that they guided the team, but they wouldn't maybe have done those themselves. And so I think it's just an example of how critical rural training is to this overall equation. And in Thermopolis, we have the rural training track. It's an incredible program. It's really successful. If you're not familiar with it, a resident would do 1 year at the Casper program, and then they do the subsequent years in Thermopolis. They're embedded in the community. Thermopolis has that one residency slot each year that they focus on. Those residents are staying in Thermopolis. Also, anecdotally, Thermopolis is delivering a good number of babies, and they're all family physicians. And so I guess I would offer, it's all really complicated, as you've heard. There's a lot of promise. There's a lot of opportunity. They're really complicated conversations. I think the residency deserves our focus. And that's when I know Ms. Davis mentioned our research into OB fellowships that can be tacked on. You can do an extra year at a family medicine residency and come out with an OB fellowship. It's an enhanced training. Casper already has an OB track that I think is also worth looking into. And so I'll come in August prepared to present a lot of that if it would be helpful to the committee.
Bien.
Mr. Chairman, thank you. Ms. Bush, do you think incentivizing some state incentivization or grant program for hospitals to encourage open residency programs would be useful?
Ms. Bush?
Mr.
Say
Chairman,
maybe.
Representative Yen, I'm not sure I know what you mean by open, like to open a residency program. Is that what you mean? I think residency programs do best when they're affiliated with a university or a medical school. And so I don't know what the feasibility of that is. We could absolutely look at it. I know Cheyenne and Casper hospitals work really hard to partner with the residencies. The residents rotate through those hospitals and do a lot of their rounds, including on the labor and delivery floor. There was a group of physicians about 5 to 8 years ago who looked really hard at trying to start an internal medicine residency somewhere in the state. They were pretty passionate about it, and it just didn't come together. I think it just didn't work out on paper. That's not to say we shouldn't look at it again. I know there was also a group similarly looking at maybe a psychiatry residency due to the mental health shortage that we have in the state, and it didn't really come together either. But it's always worth revisiting the conversation, I think.
Yep, follow up, Senator Dockstader.
Theoretically, if we did that, and maybe Representative Yan, what kind of dollars are we talking about to do something like that? How much?
Mr. Chairman, Senator Dockstader, the cost of starting a residency and then maintaining it, I think it's an interesting one, and this committee is probably familiar, but it's worth mentioning that back in the 70s, when the state of Wyoming established the University of Wyoming Family Residency Programs, there was an opportunity to get direct federal GME funding, graduate medical education funding from the federal government. And Wyoming declined to engage in that partnership. And as a result, we don't have the opportunity to re-enter that partnership. And so we're the only state in the country where there is no federal funding support for our residency programs. They are fully either sustained on revenue generated by the clinic itself, which is further sort of made interesting by the fact that we divided our residency programs into the clinic side functioning as an FQHC in order to capture enhanced reimbursement, and then the residency program being the training side, which remains under the purview of the university. So in terms of cost for ongoing, we know that number directly. It's in our budget each year. And that's, what it requires for the state to invest in those residency programs to provide for their sustainability. It's that number combined with the clinic revenue that gets generated on the FQHC side.
Any more questions from the Medical Society? I am not seeing any, but as part of the governor's OB working group, you're also committed to maybe getting us anything we can do in the legislative branch.
Mr. Chairman, we'll always do our best.
Thank you. All right, we're gonna keep talking, just so everybody's kind of aware of how I'm moving through the agenda. Keep talking about maternity care, and then we're gonna talk about daycare, and then maybe we'll talk about tort reform after that. And hopefully take a break after that, but we'll see how it goes. So is anyone here to testify on maternity care, delivery, those services? Okay, let me double check online. Anyone online to talk about care? Yeah. Didn't mean to scare you away. All right, well, let's talk about daycare then. Oh, now I have people. It's amazing, as soon as you try to close something, everybody jumps on. Let's start with the Hospital Association. Mr. Hannes, I saw your hand raised. Anything to jump in on maternity care?
Good morning, Mr. Chairman, members of the committee. Josh Hannes with the Wyoming Hospital Association. I don't actually know that I have anything else to add. I think I don't want to repeat ground that we've already covered. We do participate in the governor's healthcare task force, and specifically on the OB committee. We're evaluating all the ideas that have been talked about here and more. I did want to point out, it hasn't been mentioned yet, the University of Wyoming does have a grant also looking at OB and maternity care. There's a lot of overlap between the members of the governor's task force and people that are on the advisory committee for the University of Wyoming. Again, looking at things like training and recruitment, how do you address social determinants of health? That project is very early in its stages, so I don't know that there's anything concrete to bring forward to this committee at this time, but just wanted to make you aware of that parallel effort. But like I said, I really don't want to go back over anything that's already been said. The speakers before me have done an excellent job, so I would stand for any questions.
Any questions for the Hospital Association? Don't see any, but certainly appreciate you being here today. Remotely, although Pinedale is nice. Just letting you know. Mr. Gomez, welcome. Floor is yours.
Thank you, Chairman, members of the committee. I'm Carlos Gomez, the Executive Director for the Board of Midwifery. I mainly just wanted to make myself available in case there's any questions that the committee would like me to take to the board.
Look at that public service response. Representative Yin, go ahead.
Mr. Chairman, thank you. Mr. Gomez, I think my question would be, what are the issues that the board thinks is blocking midwives from working with local providers, as well as would any of the board members be able to testify at our next meeting about what their issues are as well?
Mr. Gomez.
Thank you, Chairman. Thank you, Representative Yen. Actually, the board just had a meeting on June 13th where the discussion did cross not only requirements for licensure, that just came up through the normal rule review process. And there, was some discussion about, where that stands in basically making sure that that's, where it needs to be. Nothing definitive was decided, but the discussion was acknowledged, as well as an acknowledgement that there aren't many midwives in the state of Wyoming. Currently there are 16 active in the state licensed through us. As far as inviting, obviously I can't speak on their behalf, but I will definitely reach out and see and communicate to the board to see if that might be something that I could do. I could definitely reach out.
Yeah, other requests? Seeing Representative Clouston, question?
Yes, thank you, Mr. Chair. And Mr. Gomez, if you could bring to us the 16 midwives in the state, do they all have liability insurance? And then what is the cost of that liability insurance? Just thinking maybe if that's an inhibiting factor.
I don't know if you know Mr. Gomez, or if you could find that, that would be great.
Thank you, Mr. Chairman. Representative Clouston, I do not have that information readily available at hand, but that's something I could definitely dig into and see what I could find.
Thanks. Other questions for the board? Seeing none. Thanks for being here today. All right. Anything else on maternity? Thank you. Seeing none, let's jump into like daycare. Is that, I guess, the appropriate title? And I know, Ms. O'Connor, you have a memo as well. Maybe that would be, you can kick us off if you wouldn't mind. Welcome, Roxanne. Floor is yours.
Thank you, Mr. Chairman. Committee members, my name is Roxanne O'Connor. I'm the Support Services Senior Administrator for Department of Family Services. I can keep my comments relatively brief to help with the number of topics that are being discussed. We did follow up from the April conversation with a memo regarding a couple of questions that were asked of the department. One of the first question that was asked was about childcare ratios and training requirements and what the other 7 surrounding states for Wyoming look like and how Wyoming fits into that. Far and large, Wyoming fits into the median of those requirements from both a ratio perspective and a training perspective. There are a couple of outliers, one in regards to ratios for children who are 5 years of age. And the main reason for that is because Wyoming doesn't categorize, I should say in our rules, we don't categorize 5-year-olds as school age until they reach school. And so we combine 4 and 5-year-olds, and that's the reason that we're seeing a little bit of an outlier there. It's not much. It's talking about, 1 or 2 children that were more restrictive than the median on, but it's certainly something that we'll look into. As I mentioned last meeting, we are going through a pretty rigorous rules review process. And that's certainly something with this information that we can consider. Additionally, in regards to training, the Wyoming falls within the median for training of childcare providers and ongoing training of childcare providers in childcare centers. In childcare homes, we have 1 more hour of a requirement per year than what we see the median being. Those training requirements, it's important to note that about 12 of those courses are health and safety requirements that are required by the Child Care Development Block Grant. And then we have an additional 4 that really lend themselves to child development and really the quality aspect of care. Those training requirements are of interest to the Joint Education Committee, who's also talking about childcare and preschool from a quality perspective and a definition perspective. So certainly looking into those and how Wyoming can align with the median as we go through the rules process, and really trying to strike the balance between health and safety, our federal requirements, and the quality perspective as well. The second question that we were asked to look into had to do with the reason that we see childcare providers closing, exiting the industry, if you will. And so after our conversation in April, we did survey about 300 providers who had closed their programs within the last 5 years. And we were pretty intentional about 5 years. We wanted to make sure that it wasn't just a matter of the COVID effect, if you will, playing into the data, but trying to get a little bit more robust data even before the pandemic hit. We had only 34 responses out of about 300 providers surveyed, which I'm not really surprised about. Once you're out and probably don't want to respond to a survey request, would be my guess. But what we saw is there were 4, main concerns that really rose to the top in those responses, 2 of which were had to do with financial feasibility of childcare programs. And so looking at operating costs and looking at profitability to be able to make a living wage when you are in a childcare program or running a childcare program. Those were barriers to being able to maintain participation in that industry. And that's where DFS, like I mentioned in April, we're partnering with the Wyoming Business Council, with the Department of Workforce Services, with the Harvard Growth Lab to really look at early care and education from an economic development standpoint, and seeing how the Business Council might be able to help with some of the small business supports like shared services for administrative functions or marketing or producing business cases to be able to help programs be a little bit more economically feasible in their industry and where their passion lies. And so that's really where we're trying to look at some policy options, maybe even some startup grants to be able to assist providers in being able to help reduce some of those barriers. Like I mentioned, licensing and regulatory rules were also one of the barriers. We are working very hard on our rules review to make sure that provider voice is elevated, to make sure that it's reflected in our next rules review. And as a result of that, we've put out another survey to current providers asking them essentially, what are the rules that are barriers for you? What are the rules that are hard for you? We have not closed that survey, so we are still getting results every day, but preliminary results show that about 69% of the respondents say that there aren't necessary or unreasonable rules. But just because that's the majority doesn't mean that we're not looking at the minority and their comments as well. And so what we're seeing is about 13% of respondents have said that the ongoing or training requirements, like I've already discussed, were something that we needed to take a look at. Also, staff and child ratios, less from a number perspective, but more from just an understanding perspective. Ratios are hard when you have different age groups with different numbers that require different staffing levels, and those change, right? Those vary all the time. And so how we're looking at other states on how we might be able to make that a little bit easier to apply and practice for childcare programs. And then also background checks and some of the staffing requirements in regards to just how long they take. That's also a conversation that is happening at the Joint Judiciary Committee meeting. So there are a lot of committees that are now kind of intersecting into the early care and education realm that I'm hoping that we might be able to see some, pretty significant movement for providers in those areas. And then also the last response in regards to why do we see providers exiting is they retire from the industry. And if you are a family childcare home and you are the sole operator and owner of the program and you retire, that means the program closes. And the majority of respondents were family childcare homes. And so like I had mentioned previously, we're just not seeing a pipeline of individuals who are interested in starting up family childcare homes. And we see that in the data, we see that in these responses.
Would it be fair to say that there aren't people that really engage in this work until they may have a kid of their own, and then for cost savings, they engage in, you know, a 4 to 6 year window, and then as soon as those kids are old enough to go into the public school system or home, whatever it might be, they relinquish their license and go about their day. So it's not something we have a pipeline for, because nobody really thinks about it until they realize the high cost of childcare. Is that anecdotal, or is there any evidence to support what I just said?
Thank you, Mr. Chairman. That's fairly anecdotal, but we do hear about that, and we see that from just a licensing perspective on who has interest in becoming licensed. We also kind of along those lines, we have asked about if you are provided a child care subsidy and you're a child care worker, right? So it doesn't necessarily need to be through DFS. That could be through a child care program, where if you work for a program and you have a reduced rate or free childcare because you work for a program, is that an incentive for you to stay? Is that an incentive for you to work in a childcare program? And it certainly is, and that's what we've seen from survey responses from providers.
Questions for Representative Penn?
Thank you, Mr. Chairman. Couple of questions. The training, and we kind of brought this up before. I know that a lot of the hardship with the training hours is the fact that 50% of them are required to be in person. Is that something that you're looking at when you're doing your rules? Wonderful.
Mr. Chairman, Representative Penn, yes, we are.
Follow up, thank you. So looking at the survey results on the back of this page, looking, 38% said licensing or regulatory rules was a reason for them closing their program. It looks like there's some things it seems like maybe we're fairly median, or most things it seems like we're fairly median as far as some of these requirements and the staffing ratios and things like that. We've been having the discussion with the maternity care earlier and saying, how can we incentivize this? My goal with trying to stay within the proper role of government is providing the incentive via decreased regulation. So I personally would like to see that rather than the median, we're on the low side of the regulation of this, so that when we have, we have our retirees and that program is closed, that we have incentive for new businesses to start up. What I've heard is when people, as our chairman brought up, sometimes it is a circumstance where suddenly this parent needs childcare. I can't find childcare. Maybe I can provide childcare for mine and others. But when they look into what the process requires, it's just like, no way, I can't do that. And so I would like to see ways that we can, even though we're at the median, how can we even back that off further so that people feel, I think that 38% is too high. If we have 38% of our businesses have closed, the ones that have closed, because of regulation, then we have a lot of room to improve. And so I appreciate the fact that you guys are doing a deep dive into that. Do you have anything you'd like to comment on that?
Thank you, Mr. Chairman, Representative Penn. I think my comment would be that we have a shared goal there to say, where do we really find a balance between health and safety requirements, making sure that those are met in regards to the nurturing of these children and the development of these children, while also making sure that we are providing as much support and technical assistance to providers as we possibly can to make sure that they do know that this is a welcome business to come into, that it's one that can be profitable if you have the right supports. And we want to be a part of that call to meet those supports. So I think it's a partnership between a lot of the entities that I mentioned from a business support perspective, but then also looking and saying, what makes sense from a common sense perspective in regards to our rules and what doesn't make sense? How do we make sure that provider voice is really a part of that? And then how do we make sure that our rules reflect that?
Got mad.
The question for DFS. Not seeing any in person or online on the memo. Thank you much then, Ms. O'Connor, or keep going.
Mr. Chairman, if I may, I wanted to just kind of let you know that I took a cue from you, Mr. Chairman, in regard in regards to the conversation about nannies. Certainly the department can look at, as we're going through the rules process, or we're positioned at a pretty well time to be able to look at nannies. If it's the desire of the committee for us to include an exemption in our rules, we would look at defining nannies, what that is from a numbers perspective, what that is from a location perspective, and we can incorporate that into our rules review and promulgation as well.
Okay, I mean, it's one of those things, I'm not sure I want more rules and regs unless we need them from a state level. I don't know, there's no guide, is there guidance we can put out that's not quite a, a regulation or a rule? I don't know if whatever the softer level is, but I'm hesitant to just jump in and say, well, there's a couple of issues in different parts of the state. Let's start doing some rulemaking on it. If there's maybe more information and it's more of a local control issue, we can say, here's some guidance from DFS on how we think you could structure this in your community until, we're trying to go for less regulation. So I don't want to get you into putting up more if we don't have to.
Thank you, Mr. Chairman. We'll take that guidance into consideration and see what we can do to develop some information around nannies and how that will look.
All right. I think you're off the hot seat. Other people here on daycare and associated issues? Ms. Duncan, come forward. Welcome back. Who are you with this time?
Thank you, Mr. Chairman. Shelley Duncan, representing Wonder School, and Emily Walton is on the screen. She is the actual Wonder School representative. Wonder School, real quick, they partner with states and businesses to ensure that every child has access to high quality childcare close to their home. That's their premise of their model. They are more of a home-based model. Since 2016, Wonder School has led in providing integrated childcare solutions balanced with technology and services to meet the needs of families. They offer an integrated approach that includes new supply creation, business sustainability, teacher recruitment, and technical offerings. They've worked in many different states, partnering anything from creating new seats for states and different products. One of the things that's really unique about them is that they spend 2 years with a new entrepreneur and they give them technology and products to really create as a business, and gives them the support of that technology, a website, marketing, applications, all those kinds of things. And then on the other side, they literally hold their hand through all of the licensing, education, everything. And then they stay with them for 2 years to ensure that they are successful. And then they move on. I've been involved with conversations with the Business Council and the other members of different parts of the task force. And we have a unique situation where we've been talking about a real radical idea of maybe some sort of a substitute new recruitment program throughout the whole state, and to be able to kind of model it after maybe something like the temp service or something like the traveling nurses, to be able to help resolve some of these real intense situations where you have no one, like Du Bois, for example. So I'll hand it off to Emily. She's going to present to you what they've come up with as a statewide program for teacher recruitment, as well, or for providers as well as substitute, because as we know, burnout is like one of the first number one issues. Think about if you are a home provider, it's just you. You have no help. You have nothing to give you a break. And so having an option of a substitute to be able to pull from that group, or even centers, they really have a problem with lack of staff. So I'll pass it off to Emily.
Welcome, Emily. Floor is yours.
Morning, Chair. Thank you for having me today. I'm going to share my screen real quick. And thank you for the introduction. Let's see here. Make sure I do this right. You'd think after working from home for many years at this point, I would have this down. Okay. I think you can probably see my screen. My name is Emily Welton. I live in Oregon, but I do want to say I lived in Idaho for a long time. I'm the oldest of 10 kids, and my mom was a midwife. So I've been listening to your conversation all morning. Very interesting. And now I'll talk about some of the childcare work that we do. So as you see here, and Shelley mentioned, we work on making sure that children and families have access to in-home care and care 5 minutes from their house. We're doing work all over the country. I'll show you a slide about that in a minute. And what we focus on is technology solutions. I'm sure you're very aware, in the K through 12 space, people have all kinds of technology access. And in the 0 through 5 space for that childcare, there's generally very little. And so we're here to help bolster that. And one of the products that we have to work on that, as Shelley mentioned, is Substitute Pool. Our shorthand for that is Subpool. And this is just an overview of some of the work that we've done in Mississippi with their Department of Human Services. And so as you're aware, we've got people who provide care either in a home or in a facility, and they get burnt out. They need someone to come in and cover them when there's vacations or someone's sick. And, imagine being an in-home provider and you take care of a certain number of kids and you're ill and you have to shut down for the day, right? Then you've got lots of families affected. The children have to go and be home that day, and people can't get to work. And so this is, ends up being a real issue with the workforce and with the economy. And so we have a platform where we recruit, train people to bring them on board to be substitute teachers. And then when a care provider needs that substitute to come in, they can go on, say, I need someone to come in and fill a slot Wednesday at 9 a.m. And then they pull that in and they're able to have that substitute person come in. We know that this reduces burnout. We know that this really helps providers be sustainable. And we know that it helps those new childcare programs that we all need to happen across the country to stay up and going. So this is just some of the numbers we were able to pull in Mississippi. We've got, nearly 5,500 applications. We've got 277 providers on the platform. And then we've got 70% of job matches. And that's just pretty high match rate, pretty high pay about that. And happy to inform you more about how this would work, but this is a product that we're excited about, and we're talking with states about it across the country. And then I'll just show this last slide so you get an idea. We're a nearly a 10-year-old company, and this is work we do across the country with other states. So, Idaho's on here, new provider creation, doing business sustainability. Another one on here, Nebraska, doing business sustainability. So that really consists of working with providers, helping them make sure their programs are profitable, make sure when they have an opening, they can fill it right away. So they don't miss any opportunities there, and then making sure that folks have the information they need to find providers. I will stop there. I know you've had a long morning. I'm happy to take any questions. I appreciate your time.
Well, perhaps the main question is, what's stopping you from jumping into Wyoming and helping us out if you're in 47 other states?
Well, nothing at all, except for we would have to have a contract to get paid for it. So that's the only barrier. But happy to have a conversation about that.
Well, I think Ms. Duncan and I, we can all talk offline and see what the field looks like, I suppose, and what it would take and how it works in other states.
Thank you.
Questions? Committee, not seeing any. Thank you very much for being here today.
Thank you.
Thank you. And Mike, if you talk about the self-sufficiency book as well while you're up
Oh,
here.
sure. You got
and
it.
Some other things from the foundation.
Okay,
Go ahead.
excellent. I am just here to follow up a little bit from last time and kind of build on.
And if you'd introduce yourself,
I'm
sorry.
so sorry.
I
Thank
halfway
you.
did it for you. And
Micah Richardson with the Wyoming Women's Foundation under the Wyoming Community Foundation. And first of all, just want to say thank you all so much for looking at this issue. We're really excited to see that you all are looking at it. And the Joint Ed Committee is looking at the quality side of it as well. And we think both are just incredibly important to the future of Wyoming. So first up there, I just want to piggyback a little bit on the Business Council conversation. There is a group of us that have come together with the Business Council and the Harvard Growth Lab and have looked at a number of issues around this topic. The Business Council, of course, has recognized this as an economic issue. If you don't have childcare, you don't have folks being able to go to work. And so that is their interest in it. And the Growth Lab has done some work on the ground in Wyoming, visited Sublette County and also Sweetwater County, interviewing providers there, and are about complete with a white paper that they created from those interviews and just from doing some research. And so we will email that to you, I would guess within the next week or two, but they would also be more than happy to present on their findings at the next committee meeting or beforehand, whichever you, and if you would like to hear from them. So I just want to share that information. Just making sure I'm following my notes here. So within that committee, as we said, we've been brainstorming a lot of ideas. Some of that they've looked at regulations, also looked at the feasibility and profitability of having in-home care, but some of those which they will talk about and addressing some of the issues to burn out, that sort of thing. But there have also been some other ideas that have thrown out there in terms of childcare workers being provided access to subsidies or free care if they are providing care in their community. One thing we haven't discussed within this committee, but student loan forgiveness for those providers who are working in the field. And then, I mean, and I will say that a lot of these ideas that I am presenting right now and throwing out there do take some money, and deregulation or loosening regulations doesn't take as much money, but I don't think that's the only fit. I've also talked with providers who say, I do not want to watch more than 10 kids. That feels really overwhelming to me. That feels like a good number. So I think there can be a balance of both things. We've talked about small startup grants which I know Roxanne mentioned. And another idea that I've been exploring, the Women's Foundation has been exploring, is a TRICARE share model where a business can put in funding, individuals can put in funding, and perhaps sales tax or other sort of tax could be utilized to create a fund that then could be used to keep to provide funding to providers. And that needs to be explored more on our end. And so I'm just pitching that out there and can do more explanation or exploration on that. So anyway, just want to give you an idea of some of the things that we've kind of explored. And like I said, Business Lab and Growth Lab, I mean, is more than happy to share just kind of the data that they came across, thinking about it from the economic perspective. So are there any questions on that side? And if not, I'll jump into our self-sufficiency standard.
Questions, Representative
Mr. Chairman, thank you, Ms. Richardson. I think those are all good things to keep exploring. The one that piqued my interest was that last one, where the TRICARE could allow for communities to give some taxpayer funds into that direction. So I did have a bill a couple of years ago that allowed for communities to put on their ballot a tax for themselves towards childcare funding. Is that something that would be worthwhile in exploring with that conversation?
I would be happy to explore that. There are currently counties can implement a mill using BOCES. They can implement a BOCES mill that can be utilized towards childcare. We're exploring that as well, and Pinedale actually utilizes that BOCES mill. And so it could be, like I said, this is kind of initial steps of exploration. And so we'd have to really look into what are the multitude of options that could be utilized, and does it make sense? So yeah, happy to discuss that more with you, look into it more, all those good things.
Okay, checking online, not seeing any, but yeah, if you talk about self-sufficiency real quick.
Sure. So the Wyoming Women's Foundation just recently created our self-sufficiency standard. And what that does, and I'm going to give you just a quick background. The federal poverty level looks at poverty based on, it was, I believe in the 60s created based on the cost of food times 3. The self-sufficiency standard looks at actual cost per county. So break it down by transportation, by health, by groceries, by housing, utilities, which is wrapped into the housing piece of it, to allow you to see what it takes to make a living in your county. That's the bare bones minimum. It does not include any kind of going out to eat, going to the movies, anything like that. It's very bare bones. And so we are happy to share that information with you. I can email that to you, but our website is wywf.org, and the home screen has the link to that. The standard itself is pretty robust reading, but has some really great information. But we also have a self-sufficiency calculator on our website. So you can go in and plug in what county you live in. If you're a 2-parent household, a 1-parent household, how many kids you have, and it will break down those costs for you. It's not the most uplifting to look at, especially when we're thinking about housing costs. And but as a note, housing and childcare costs, if you are a family that has children, typically make up about 45% of the cost for a family. So something to keep in mind, but would love for y'all to explore that, and can reach out to us with any questions.
Thank you. Yes, Senator Dockstader.
Appreciate that information. I'd like you to send me some. Do you have any solutions though? Over where Representative Yin and I live, cost of living has gone off the charts. I look at young families just fighting constantly. Forget the burgers and the movies. They're not doing any of that. They're just simply trying to exist in a world that's changed within just a few years. Have any solutions?
That's a tough one. Yeah, I mean, I think we're all looking for them, right? And if it were really easy, then I probably wouldn't be up here, and y'all wouldn't be up here trying to figure this out too. So there are some things at the local level that can be done. We had a little bit of a discussion last night, and this is veering off course a little bit, so I don't want to get too far down this road, but thinking about local solutions to housing, regulations and code and zoning requirements, that sort of thing that can help make housing a little bit more affordable. That's one approach. And that's a little bit tricky as well, because even as you're thinking about those reductions to zoning, costs of materials aside, I mean, there are a lot of things that play into this. Another thing that we have talked about as thinking about the importance of those families who are trying to make a living and the supports they receive. So, the TANF support, the medicated support, all of those sorts of things. Once you start making a certain amount of money, you no longer have support. So if the cutoff is, $25,000 and you make $25,001, all of those supports go away immediately. And so something we have been thinking about is there a way to kind of step down those supports? So as families, as they want to get better jobs, as they get a raise and that sort of thing, they are able to kind of manage that and save for those next steps as they are making an increased amount of money, so that they are continuing to provide or to find that support, and not just finding themselves, they call it the cutoff cliff, where it's like, boy, I was getting some support and now it's gone. It's real difficult to manage your finances when a cliff like that happens. So what does it look like to kind of step that down? And again, happy to share information and research on that. And I know, again, like those all cost money and so the zoning stuff doesn't though. Other questions?
Ready? Seeing none. You're off the hot seat.
Thank you. And will also share a couple of ladies from the Du Bois Local Board. And that you heard from, one of the women that you heard from last time and another one are on the line if you are interested in hearing from them too.
Well, we're interested in hearing from everybody all the time. So yeah, anyone else on daycare issues, feel free to come on forward, or if I see a hand raised online, we can certainly go online too. But I'm not seeing anybody jumping up on the internet, so, yep. Oh, thanks. There's Casey and Sarah. I don't know which one wants to go first, but you're both welcome to the floor. First one that got their video on is Casey. Go ahead.
Uh-oh. Thank you, Mr. Chairman, and thank you to the committee. I just want to start by saying thank you for entertaining my comments and my requests for examining the nanny care issue or the in-home care issue that I brought up at the last meeting. I read the memo and it sounds like it might be a better place. And I'm just asking for some clarity, I suppose, that it might be a better issue to address at a local level before going to a state level. Is that what am I going in the right direction with that idea? I'm seeing a nod. Okay.
I would say you are, and my opinion, nobody on this committee is usually jumping up for more regulation or rulemaking or statutes that we don't
Neither
have.
am I.
That doesn't work for you. We're certainly happy to come back and see if there's a state level fix, but if it could be a local or county fix and there's anything we can assist you with, certainly agreeable to do that.
Okay. Secondly, I just wanted to echo my support for the potential or for the bill that Senator Yen had proposed about the, I believe it was called TRICARE. I don't know the official terms. Just speaking as a parent, for asking businesses to allocate a percentage of their profit or a sales tax percentage or however it worked out towards supporting a daycare or daycare options for families that either work for them or in the area to support more families in this, to allow for a more robust economy in our small and local communities. I would love to explore that more and see if it's worthwhile to bring to the floor again. That's all for me.
All right. Sarah, did you have anything to jump in on?
Yeah, thank you, Chairman and committee members, and thanks for your attention to these topics. Both are important to me on maternity care and the child care situation. I just wanted to add to what Casey and Micah both shared. Since the March closure of our sole daycare here in Du Bois and that serves the Du Bois and Crowheart areas, we really have been in a pretty urgent state of needs as parents and people who contribute to our communities financially. I'm part of a new group that's just starting up a new child care center here as a nonprofit model. But as you've heard today, we're really struggling with the financial feasibility aspects of this. Everything from the balance of finding quality caregivers to provide that quality care to our children, to also, while also providing the living wages that these people need as caregivers. We're also trying to balance that with charging fees that are considerate of what people and parents and caregivers or parents can afford. And so it's just, I guess I'm just here to say we really appreciate your attention to this. It's something that is affecting, of course, our small community, but in ways that are pretty telling when teachers have to make a decision if they're going to be able to keep their jobs come August if we aren't able to open our doors by August 1st, because they need to make those decisions on whether or not they have childcare for their kids. So I know there's several parents in that state right now. So there's just a lot of effects to our larger community when childcare is in such an urgent crisis. And we appreciate your attention to this, and certainly hope some changes can be made moving forward so that we can provide care for our kids.
Thank you, Sarah. Any questions, committee? Not seeing any. Keep up the fight and check with us in August or with Micah, and we'll yeah, good.
Just curious if you got a business plan, Sarah, on that. Is one of the parents going to run the place, or are you still looking for that position? You found the solution of combining everything under one roof. Who's going to manage it all?
Yeah, so we're currently in the process of hiring for 3 different positions for our Little Lambs Child Care Center. And it has been a long running challenge here in Du Bois and Crowheart to try to find a parent or a person in our community directly that's willing and wanting to do the work. So we're really hopeful. We have some interviews this next week that hopefully something will work out there. But no, we're planning to have a director position that will be, responsible for the day-to-day operations of the center.
All right. Thank you guys very much. Anything else on daycare? Okay, let's take a 5-minute break. We'll talk about tort reform, then jump into the healthcare authority, and then see if there's any bill draft ideas that are generated over break. So let's say 11:13, which really means 11:15, but we'll try for 11:13. All right, welcome back. From our 6-minute, 14-minute break. Next up, we do have a memo on tort reform that LSO has provided. Is it Luca, Mr. Plum, if you take us through that memo, please.
Yes, Mr. Chairman, I put this one together. It's a little lengthy, so I'll try and kind of move through it. But yeah, if there are any questions, I'd be happy to address those. Really, this memo does just kind of take a broad look at tort reform, medical malpractice liability, things in Wyoming, and then I did just a quick survey of some of our, of our surrounding states. And so just to start off, I think what's important to consider just in the context of this conversation for tort reform and reducing medical malpractice in Wyoming is that the Wyoming Constitution specifically addresses tort damages in Article 10, Section 4, which reads that no law shall be enacted limiting the amount of damages to be recovered for causing the injury or death of any person. And so, yeah, so that'll come up in other places, but there are already some legal provisions relevant to medical malpractice in Wyoming. First would be the Wyoming Governmental Claims Act. And really, this is just where the state of Wyoming, is generally immune from suit except for those authorized by the legislature. And this was passed in 1979. So it's been on the books for a while. But specifically in the healthcare context, there are two instances where the WGCA specifies when a governmental entity is liable for damages, and that involving public employees. And those who are acting within their scope of duties in operation of any public hospital, specifically for negligence of public employees when they're operating a public hospital or providing public outpatient healthcare. But then there's also liability for healthcare providers, who are employed by the state who have caused injury, wrongful death, or property damage from medical malpractice. And so in those instances, the maximum liability of a governmental entity is limited to $250,000 to any claimant for any number of claims that arise out of a single transaction, or $500,000 for all claims arising out of a single transaction or occurrence. There is a 1-year statute of limitations on these claims. And this was actually challenged, but the WGCA has been held constitutional just in general, considering Article 10, Section 4 of the Constitution, really just where it was basically found by the United States District Court for the District of Wyoming that since, under the common law, the government is generally immune from any types of these suits. Anytime that they do allow these suits to be brought, it is reasonable that they limit those, limit the liability to those specific dollar amounts. The next section that is currently on the books is the Medical Liability Compensation Account, which was enacted in 1977. It's been around a long time, but it doesn't sound like it's ever really fully operated. It's essentially a program to create a pool for physicians if they maintain medical malpractice liability coverage of at least $50,000, then the point of this account would be to help settle any award or settlement that be adjudicated against a physician beyond that $50,000 if for a qualified physician, and it's only up to $1 million, that can be covered by the account per year per physician. I provided some just additional information about how that works, but I do think it's important to note that, this was, from the Insurance Commission, they noted that they don't believe that the board was ever appointed by the governor's office. There was discussion of bringing it back in the early 2000s when there was the medical liability insurance crisis, where the major carriers were leaving the state fairly rapidly. But since then, it's noted that the situation had calmed down and there is a competitive market for medical malpractice liability insurance now. And so, so that's kind of the important part there. But so while this program is still on the books, it doesn't sound like it's ever actually been utilized. The next important, on the books law regarding medical malpractice claims would be a statute of limitations against a private healthcare provider. So separate from the Wyoming Governmental Claims Act, statute does provide that if there is an instance where a licensed or certified professional or healthcare service, is negligent, causes injury or anything like that, an action can only be brought within 2 years of the date of the alleged act, error, or omission, after the discovery of the act. There are some exceptions slightly for minors, but that's just the general, for children and people like that who have a disability. But generally it's 2 years. And then there's also limits on the admissibility of evidence for actions against healthcare providers, essentially saying that any statements, affirmations, gestures, or conduct that expresses apology, condolence, compassion, or a general sense of benevolence that are made by a healthcare provider can't be brought as evidence in court for, during a medical malpractice action. So that's kind of what's currently in Wyoming law. I have also provided some information on tort reform options and prior legislative efforts. The first one, and a lot of this did come around when the Wyoming legislature came to a special session in 2004. As I mentioned just briefly earlier, there was that medical liability insurance crisis. There were very few providers in Wyoming in the early 2000s. And so the legislature came together to try and address that specifically. The first item of note is there was a constitutional amendment that was passed by the legislature. It was ultimately rejected at the general election. But the point of it was to amend, that Article 10, Section 4, where it says you can't limit damages for injury or a wrongful death. And what this amendment would have done is it still maintained that there would be no limit on the amount to be recovered for economic loss, such as, wages, bills, anything that's, can be very set to a dollar amount. But it would have provided that the legislature could limit non-economic loss resulting from the death or injury, such as like pain and suffering. So that one did not pass, but during the 2004 budget session, the legislature did pass, and it was subsequently ratified by the voters that would allow for the medical review panel, for malpractice claims. And essentially what this did was just say that the legislature could mandate alternative dispute resolution or review by a medical review panel before the filing of a civil action against the healthcare provider. And so that passed, and there was created the Wyoming Medical Review Panel Act of 2005, which essentially stated that, before your medical malpractice claim could proceed to court, you had to go first to this review panel. And the idea is to limit and kind of weed out any frivolous claims that may arise. And that's a very common theme I'll discuss from the other states. But this act was ultimately repealed in 2021. I wasn't exactly clear on why it was. I do believe it may have related to budget cuts and those kind of things. So, but the panel, so that is still, it's still within the Constitution that there could be a medical review panel. And there is already the basis for, the previous act of 2005. But essentially, the decision of the panel was not binding on the parties. It was just that first step. Another program that was passed during the 2004 special session was the Medical Malpractice Insurance Assistance Account. And this was another one where it kind of had two parts, and it was designed to assist physicians in paying medical malpractice insurance premiums through a loan process. That was the first part. And it required the physician to enter into a contract with the state for the physician to practice their medical specialty in Wyoming for not less than 3 years. It set eligibility requirements, and it was essentially a loan program that you had to pay back, but it was just to help cover those costs when they were very high. That program was repealed in 2016. And then the second part, which was ultimately repealed in 2021, was more about creating a risk retention group that was through a loan process. And this was more a program that was going to be owned by Wyoming physicians providing medical malpractice insurance. And it differed because physicians participating in the group were required to practice their medical specialty for the entire time that they had a loan that was outstanding. And so those are kind of some of the current and prior efforts that have been made to address medical malpractice liability, attempts at tort reform in Wyoming. I just did provide just a brief run through of some constitutional considerations just for any of these programs and for that the committee may wish to look at when deciding if and when they'd like to bring a bill draft. The primary ones are, Article 16, Section 6 of the Wyoming Constitution, which prohibits, loans of credit and donations. And then also Article 3, Section 36, which prohibits appropriations for charitable industrial, educational, but benevolent purposes that are not under the control of the state. And so essentially what it boils down to is that the legislature cannot levy a tax or make an appropriation except only for public purposes. And that is somewhat, there's never been judicially defined what a public purpose is necessarily. So it really is more conceivable that the definition of public purpose may depend on the particular facts and circumstances of the case. And then there's also the thought that, any appropriation that the legislature makes, sometimes you can meet that public policy or public purpose requirement if there's consideration received. There's certain instances where, that wouldn't be, allowed, and it's still a fact dependent issue, but it really is begging the question of what did you give to get what you got, essentially when you're making an appropriation. And so the Wyoming Supreme Court has considered these provisions in several cases throughout the 20th century. I won't run through all of them in great detail. I just gave a quick synopsis of each, but there's instances like, there was a case where a county made an appropriation to a private county fair association, and that was held to be unconstitutional because it was a donation by the county to and in the aid of a private association. But then, and then there's a couple other ones, but then, they came back to the county fair example where it was an appropriation was made to a county fair board that the commissioners had appointed. So it was held that it was to a county fair board that was acting as a state agency. So that one was appropriate. But essentially, yeah, it's looking for that public purpose when bringing any kind of program that may be, giving money to support anything really, truly. And then also if there is consideration. And so, as I've kind of mentioned, it's just really a court would potentially hold any legislation unconstitutional to address medical malpractice. It really, if they were to do so, it would be truly a fact-specific inquiry on those two considerations. And so then we'll quickly run through the tort reform for medical malpractice liability from other states. I did look at our 6 surrounding states. Kind of focusing on 2 areas, which is kind of the common theme, and it is limiting damage, setting a cap on damages that can be recovered in a medical malpractice claim, and then also whether these states have a medical review board. And so Colorado does set a cap on what can be recovered for overall damages and non-economic damages in a medical malpractice claim. They just passed a bill that number is going to increase. Currently, I believe it's capped at $300,000, but by 2029, it'll be moved up to $875,000. But they do not have a review board that I found. Idaho does have a cap at $250,000 for any non-economic damages, and they do maintain a review board. And generally, these review boards are informal, or if they're slightly more formal, they're still generally not binding. You can still take your claim to court, but you have to start there first. Montana has one of the lowest caps on non-economic damages at $250,000 total. But they do have their medical legal panel that hears those cases first. And then Nebraska actually is slightly different. They have their own account program, somewhat similar to the one that's on, Wyoming law, where they require that, if a qualified healthcare provider maintains at least a $500,000 insurance policy and potentially could be covered up to $800,000, that they would also kind of assist in paying any judgments that are made against a physician from their excess liability fund. And that maximum award is up to $2,250,000. And then they have a review board as well. South Dakota is a little more simple. They just call it general damages for a claim up to $500,000. They don't have a cap on what they call special damages. So that can kind of be determined by a court. And then, Utah also limits non-economic damages up to $450,000. And they also have a review board. So with that was a fairly quick run through, but I'd be happy to answer any questions.
Questions, committee? It does sound like there are some things we could work on cleanup in 2025 that may not be existing or may need modification, because it's probably been 20 years since we really looked through a lot of these statutes. Representative Penn, do you have a question?
Yes, Mr. Chairman. I'm trying to go back The account that you said use or exists, but it is not in use, trying to find where that was at. Do you know is there any money in that account? Is that, I mean, it's open, but no funds there, it's not being used. Is there money in it?
If you know, Mr. Plum.
Mr. Chairman, Representative Penn. As far as I understand, I don't believe there's any money sitting there. I did kind of skip through the operation of the account fairly quickly. It's primarily funded through a surcharge to physicians. That's, it's supposed to be run by the insurance commissioner. There would be a board appointed who would oversee it. But no, I don't believe that the board was never really created. I don't think the account has ever really been it has been funded. There's never been anybody to actually, collect that surcharge. But there is a mechanism for it to be funded through that process.
Yep, follow up.
Thank you, Mr. Chairman. Next question, you said that this kind of statute of limitations for most malpractice claims is 2 years, but not necessarily for minors. I think one of the issues with our OB problem is because that can extend, I think it's like to 18 years. Do you know what it is for minors? Is there, and I'm not sure if you can answer this question, but are there other states that have altered that? So the statute of limitations for minors doesn't extend to age 18, from maybe something that happened at birth.
Mr. Chairman, Representative Penn, I don't know about other states. In Wyoming law, it's injuries to minors are subject to a period of within 2 years of the date of the alleged act or by the minor's 8th birthday, whichever one comes first, or whichever time frame is longer.
Representative Ward.
Thank you, Mr. Chairman. So if to summarize my understanding, and I want to make sure I understand it's correct, in order to cap liability, we have to change medical liability. We have to change the Wyoming Constitution. Is my understanding correct?
Mr. Chairman, Representative Ward, yes, I believe so. That was the attempt at the 2004 session, was to pass that amendment. And like I said, that one was just, it wouldn't set a cap on economic damages, the ones that like your medical bills, anything like that. It would just set the cap on like the non-economic damages. That was what they attempted to do. But I mean, yeah, the language within the Constitution right now is fairly general and just saying that, there shall be no cap on damages for injury or wrongful death.
Yeah. Representative
Mr. Chairman, thank you, Mr. Plum. When doing your research on the caps that other states have passed, was there any result in, or was there any data in whether it reduced the liability insurance rates in those states?
Mr. Plum, if you know.
Yeah, Mr. Chairman, Representative Yin. No, I did not come across that. I was primarily looking at, what their caps were, and I didn't see if that was having a big impact on liability insurance.
Okay. No other questions that I'm seeing. Thank you. Certainly a great memo, and I do think for 2025, if there are some interim topics available, going through some of our statutes that we might have crafted in a hurry 20 years ago could be reviewed and looked at. So with that, put that on the list for next term, those of us who come back, if any. I think Senator Dockstader is the only one that didn't have an opponent. And Representative Yen, one county in the state didn't get anybody challenging them in the primary or the general. Not sure what's in the water up in Northwest Wyoming. Let's move on to the Healthcare Authority. We're almost on time. With that, Ms. Davis, you'd come on forward. There's a bill draft in your packet, committee. I know we are missing 3 members, one of which did ask that they would like to vote on it. So I don't believe, unless there's overwhelming agreement to make a final decision today, but certainly could. There's 3 staff comments, none of which are necessarily policy related. But Ms. Davis, anything new from your end the last 7 weeks since we saw you on the Healthcare Authority and conversations and where you'd like us to go today?
Chairman Zwanitzer, I don't have anything new. I've looked over the bill draft and don't really have any concerns. Saw the staff comments as well. So I don't think I have anything additional to add at this time.
And then? Nothing additional, still in support? Okay, any questions? I think we all remember the need. The nice thing about having a committee meeting 7 weeks ago is it's still fresh. Let's, anybody else here to present on the healthcare authority? We'd invite you up at this time, and you're welcome to stay up there, or if you wanna. Okay, you get seats on both sides. Yep. Representative Clouston. Go ahead.
Thank you, Mr. Chair. Thank you, Ms. Davis. So, two questions. So similar to the Wyoming Energy Authority or when we had the Wildlife Task Force, this board or task force that you're presenting, they would just only make recommendations. They cannot make any rules. First question.
Oh, go
Chairman,
ahead. Yep.
Chairman Zwanitzer, Representative Clouston, that is correct. The current authority that we have drafted and that you all have in the legislative draft does not have any regulatory authority. It will be advisory through a large group of individuals.
Thank you. And Mr. Chair, second question. Yep, thank you. We already have the governor's healthcare task force, which we talked about this morning and working on some of these other issues. Why is this needed? Why is this bill needed, and why is an additional task force needed? And would the other task force then be dissolved?
Ms. Davis.
Chairman Zwana, Representative Clouston. So the current governor's healthcare task force is just under Governor Gordon's administration. So it would be all dependent on the next administration if they wanted to continue having that or not. So the purpose of the healthcare authority that the health task force has been working on is to keep something permanent that is not at the will of administration changes, so that this work can continue on these difficult topics, regardless of the administration of the governor or regardless of, changes in the legislature, so that that work can continue on. We've had commissions in the past, and what we saw is when there were administrative changes, that things kind of fell apart. And so this would be to establish some consistency for these hard healthcare topics that, as we even talked to OB today, that span usually across a couple of years on trying to figure out solutions.
Although certainly the legislature could take it at any given year, but it would be more so under our purview than the executive branch moving forward. So Representative Hornock, welcome.
Oh.
We can't hear you again today, but try one more time. Well, we see the hand up, but we can't see or hear you yet, so keep working on that microphone, and if it works, we'll welcome you in for a question, or you could always text LSO or one of us should you need to. Other questions for Ms. Davis? Representative Penn.
Thank you, Mr. Chairman. Ms. Davis, there are 13 positions on this healthcare authority, if I recall correctly, count correctly. But it looks to me like there's only like 2 that actually involve just citizens. The rest are agencies and healthcare entities and, of course, other stakeholders. But I think one of the biggest stakeholders in our healthcare problem is our citizens. Do you foresee that being an issue with only 2 of 13 being citizens? Is there room for more? Do we need to adjust what we're seeing there?
Ms. Davis.
Chairman Zwanitzer, Representative Penn, you are accurate. There were 2 citizen members on that in the voting part of those 13. So kind of like how the governor's health task force works right now, we have a working group who is combined of different entities. That would not prohibit additional stakeholders or just general public from participating in the discussions. They just would not, we wouldn't have additional voting members on that. again, I think this is something that you all can have further discussion on of what that membership would look like. We tried, as you all know, healthcare is so huge. That size could get out of control really easily, and then not be as effective. So we tried to make it so that they were people actually practicing in the field, so that they are also not just our agencies and the typical people that we see at the table, but they're, a physician, a nurse who's actually practicing, and then with public individuals. I think it's a balance. And again, I would defer that to all of you for some more conversation if we should increase that. I don't have any opposition to that. I think it's just what's the total number that you want there, and what is the makeup of that for your voting membership?
Go ahead, Ruth.
Thank you, Mr. Chairman. I have concerns about conflicts of interest. It seems like we have these stakeholders who potentially stand to gain from the recommendations that they make to the legislature. Has there been any discussion of that? How do we prevent that from happening? If citizens can't be, there's 2 citizens that can vote, but generally they can participate, they can watch, they can comment, but they can't vote. The voting members potentially could have conflicts of interest. Do you have any comment on that?
Ms. Dave.
Chairman Zwanitzer, Representative Penn. I think when we look at membership and appointments to any board or commission or advisory, I think we look at the members who apply and then make the best decision on who those are. I know, like in our administration, the governor takes that very seriously of who is looked at and appointed. And that, I think that is why we did not put just like representation from each of the associations on there, so that it is actually a practicing member within a community. I think you could also put some additional sideboards on that if you wanted, so that it could be, you do geographical representation that maybe mitigates some of that as well. I think that we have to trust that they're going to be acting in good faith, and that there isn't an agenda that they'll be pushing, that they're acting in a non-biased way. That's the hope and the goal of all of those groups that we have. So, of course, it's a potential, but hopefully that we're real intentional in who our membership is and who they're representing. And again, I think you mitigate some of that too with the non-voting members on there for having discussion, and hopefully the people that you put on there are in the right intent on that, and it's there to have good discussion and vote something forward. And again, it's just going to be a recommendation. They don't have any authority. So again, I think as it comes forward, either to the executive branch for something that needs to be changed there, or the legislative branch for a change there, I think you have the opportunity to mitigate that at another point as well.
Okay. Senator Hutchings, and then we'll go to Representative Ward.
Thank you, Mr. Chair. Jen, I've been real honest and upfront in our last meeting. I'm not in favor of this whole process. So I'd like to ask some questions that maybe you can, in the next meeting, get us some concrete answers to maybe help me or any of those who aren't in favor of this come over to the other side. I too see this as a conflict of interest, and I really don't like the idea of, and I never have, when you want something done, you have to go to the governor's office, the executive branch. You're going outside of the legislative branch to the executive branch to gain favor or get a recommendation authorized or approved for some type of legislation you want to get passed, or a specific group wants to get passed. So for me, the conflict would be an executive branch forming a group of people and then appointing them possibly, and then they have the authority to make recommendations whether something we want to pass into law is favorable or not. So can you maybe look into and give us some ideas on potential abuses of this group? The authority they receive, do they get unlimited funding from various sources? Could this lead to outside influences that we haven't thought about? Do they receive gifts and donations or sums of money that can possibly influence their recommendations? Then, and I should have probably brought this up first, who is requesting this? Is it coming from the citizens? Is it coming from our lobbyists? Is it coming from a group of people, we don't know who they are, that just want to get involved and influence the legislature? Can you possibly give us an idea where this is all coming from? Also, I look at this as a growth in government where we have a legislative process and 90 plus of us vote on legislation, then we have to go through this group of recommenders, or the governor goes through the group of recommenders to get approval for the bill that the legislature has passed. So that's another question I'd like to get answered is, what influence can these people have on the legislature in a positive or negative way? And who wants this? Who's saying that this is a solution to a problem? And my thought that this is a growth of government. So if you can get those questions answered for me and concrete answers, I'd love to be on your side on this.
Ms. Davis, I should have started writing some of them down as well, but
I can
you
go
can
over
generally
again if
respond
you'd
to any
like.
of those. We'll let Ms. Davis go for a bit and see where we end up here. Go ahead, Jen.
Okay.
Chairman Zawanen, sir, Senator Hutchings, I will take a stab at some of those. So the first question is, where did this come from? So this actually is a recommendation that came out of the current Governor's Health Task Force. So it is the large body of individuals who come up with ideas and recommendations that we create subcommittees out of to look at pressing healthcare issues in Wyoming. So this came out of the recommendation after reviewing previous commission reports and seeing that the recommendations that commissions made in the early 2000s and in the late 1990s were some of the same recommendations that we were still seeing now. We still hadn't addressed some of those issues. And part of the problem was that we never had a body that could continue to help move those recommendations forward, either to the current executive branch or to the current legislative branch if they needed action. So that is where this recommendation came out of. It was the collective group who came up with that. All of those recommendations that they came up with went to the governor for then the governor to say, yes or no to, which he was very firm when he started this, that he wanted that group to come up with ideas and recommendations. So this is that group's recommendation of a variety of stakeholders, which has public members at large, has people from industry, has physicians. It's a large group of individuals that came up with this recommendation. And then the working group kind of tailored it all together by looking at the previous commissions and then looking at what other states had done around commissions, and then also looking at the Energy Authority as kind of a framework, since they're kind of something similar that looks at the industry as a whole and helps to partner with the executive branch and the legislative branch. So that's where this came from for the recommendation. And it looks a little different, obviously, than the Energy Authority because it's doing two different things, but that was kind of the backbone structure. So the other question of what is potential that this group would do, I think maybe there's a little misunderstanding. Recommendations would not have to go, if you all as a committee have a recommendation or something you're working on, that does not have to go through this authority group. But if you all had, so for example, I'll use OB since we've spent so much time on that. If you all had, an idea or something that you knew was complicated and really wanted somebody to have some extra time with experts in the field, this is a topic you could give to them and say, hey, could you all look at the situation that we have with OB in Wyoming and bring us back some recommendations to consider? That's how the legislative branch could leverage that group. Same with the executive branch. Maybe the executive branch said, gosh, we really would like to see what we could do around tort reform. Is there something happening in medical liability? So that could go to them. So it's really a group of experts with a lot of deep knowledge that can meet on a very frequent basis that you all don't have the time to do, that the executive branch doesn't have the time to do, that can bring the right people to the table for the right discussion and then bring back recommendations. But nothing has to flow through them for recommendations. And I think there was some misunderstanding last time too, that scope of practice would go through there. That is not what this is for. This is to really look at complicated healthcare issues in Wyoming that are multifaceted, and how can we begin to tackle those and make a difference for Wyoming. Over 20% of our industry in Wyoming is healthcare. So it's a huge driver of our economy in Wyoming from that perspective. And then the other perspective is if we don't have good quality, accessible healthcare in Wyoming, we can't grow our economy and diversify it if you don't have healthcare around. So this is really a group to hopefully help you all and to help the executive branch and come together in making recommendations to all of you that you might then have the opportunity to move forward. But again, not required to. They might make a recommendation that you all think is like, no way, not palatable. And that's okay too. That's the point of it. I hope that helps.
Any follow-up questions, Senator Hutchins?
Thank you, Mr. Chair. Your answer actually, and forgive me, but I like to shoot from the hip. It kind of made it even worse. My whole thought on this, a group of people came together and said, oh, we got a task force here. Let's expand it. Let's make it bigger. Let's make it better. Let's do things to help the legislature out. Let's do things to help the governor out. This is kind of like a mini EPA. It's like the legislature giving their authority over to someone else. And I'm using the word authority in that once this group is developed, you may not think that they would not abuse the system, but I can see little pockets because we see this with our lobbyists. Little pockets want this done and another group wants this done, and I can see them all coming together and kind of making it even worse for us. I think the legislature has the power and the authority and the ability to go out and speak to experts in the field already without forming an expensive authority to help them in any manner they see fit. And I see also the governor has that ability. But again, I just see red flags and abuses all over the place. So I still don't feel good about this. We look at the Wyoming Healthcare Commission that was formed in the early 2000s, and what became of that? why isn't that still pushing forward instead of forming another organization that's going to be a heavy burden on our taxpayers? So I didn't really get the answers that make me feel good, but I'll let other people ask some questions, and then I'll look at some of my others and come back. Thank you.
Thank you, and keep some of those questions in mind as we keep going, and you can answer maybe some at the time. Representative Ward, question?
Thank you, Mr. Chairman. I echo some of the concerns of Senator Hutchings. In particular, why isn't the current healthcare task force, or whatever the term is called, why isn't that enough? I don't see the need to expand the authority here.
Ms. Davis, you want to go again?
Chairman Zawanitzer, Representative Ward, because the current health task force is not permanent. It's under the current governor as the set who put that together. So once Governor Gordon is no longer in office, that ceases to exist. That was something that he had put in. I coordinate that for him under his leadership. But the next governor may not have that same priority of looking at healthcare. So this is a way of making healthcare remain a priority in Wyoming, regardless of administration. Again, the point is that healthcare is so important in our state, and these conversations need to continue regardless of who is in the governor, who is in the seats on the Labor, Health, Social Service Committee. These are important issues that are impacting Wyoming citizens, and it needs the same attention that other areas in the state need. And by having a group of experts, as you all know and you learned today in OB, it is very complicated. We don't have many members in our legislature that have healthcare background. We don't often necessarily have governors that their background is healthcare. So this gives us an opportunity to leverage expertise in the state to really figure out how to navigate these difficult conversations. And quite frankly, I think, again, the capacity does not exist within the executive branch to completely run this, nor should they be the only entity deciding that. We have a Department of Health, but they're only a piece of the puzzle. This helps us look at the whole picture in healthcare and make good recommendations and have good, honest discussions about things that are happening within the state and how we can make those better. So I think, again, there is the potential of, the next governor might want to continue it, which, is fine. But this takes it out of depending on who is in office to have a group of individuals dedicated to this mission of looking at healthcare.
Follow up, go ahead.
Thank you, Mr. Chairman. So Ms. Davis, I think you said this, and I just want to make sure I understand correctly. There's nothing that stops the next governor from having a healthcare task force, correct?
Ms. Davis.
Chairman Zawanitzer, Representative Ward, that is correct. And that is, would be great if the next governor did, but if they didn't, this would give us the assurance that healthcare remains a priority to be looked at regardless of who's in office, because then the following governor after that may not. So again, this puts it in place so that it remains regardless of who is the governor.
Representative Hornock, let's try it again.
Follow-up, Mr. Chairman. Two more.
Let me
Or you
see if
come
I
back
can
to
get
me.
Representative Hornock, then I'll go right back to you. It looks like it's working for him. If you can hear us. Done.
Oh, no.
No, I don't think it's working for you, Representative Hornock. But I think Senator Hutchins only lives like 10 minutes away. You could always stop in over there. Okay, you
More
keep
like,
trying. We'll come back to
30
you, Representative.
miles? Oh,
Is it?
gosh.
How's this?
Uh,
Can-
Oh, Yep, I can hear you now. Go
All
ahead.
right. Thank you. Well, I'm impressed with the other legislators that have been through this smoothly. So, a couple of questions, and thank you, Ms. Davis, for being here. I'd like to know, before we really dig into this bill draft, if there are examples from other states that we can look to, other states that have done this kind of thing and the successes that they have seen through this this separate task force from what the legislature really takes care of. So it'd be interesting to see what kind of successes there has been, examples from other states and what they've done with this. And then I'm curious also, we still don't have an appropriate dollar amount on the funding that this is going to require. So I would like to get a good idea on, I think it would be good for us to understand exactly what the dollar amount would be that we're talking about when we implement a healthcare authority. Third thing that is important, I think, is you mentioned that you want to structure this underneath sort of like the Wyoming Energy Authority. So the term authority is put into the title of this task force. And, I have a little bit of personal interaction with the Wyoming Energy Authority, and they're lacking in a little bit of transparency because they don't go through the auditor's office. They do their own bookkeeping, and they do their own spending and contracts. It doesn't go through the A&I department either. So they're really kind of a off branch, which the Wyoming Energy Authority has very significant amount of dollars that they deal with, and so it's not very transparent. I'm very hesitant to do something with another agency like that when we call it an authority that would not have the transparency that we would like to see. There's been some other comments just a little while ago about that type of transparency, interactions with lobbyist groups, interactions with various entities that stand to benefit from legislation that's passed. Just some things there that I think if we move forward with something like this, I don't think the authority is the right thing to have. I think it needs to be a much more open and transparent department within the state. So I'm just curious, how you would comment about those kind of things right now.
Ms. Davis on a couple of those, sure.
Chairman Zawanan, sir, Representative Hornock, thank you for those questions. We can absolutely get you the information for the August meeting if you would like on other states. We have looked at multiple states and have that data, so happy to get that to you so that you can have that available and for review. Also, for your question around the authority and transparency, I think transparency is very important, and we would want this group to have a lot of transparency. And again, I think that that's why it has, public, industry, legislators on it, and executive branch, so that you have all of those individuals at the table that hopefully helps you to maintain that transparency. I think you can also add into the piece of legislation if you want to craft any language in there that ensures transparency. I agree with you. Transparency is very important, and we should be very accountable for the work that we're doing. As far as looking at the membership on that and some of the concerns I think you shared before, again, I think there's opportunity in here. We're crafting something, so let's make it work and really have good input as we move forward in that. And if there is heartburn around the title of Wyoming Healthcare Authority, I don't think we have to stay with that, brand of it either. And maybe that is a confusing word to where it leads people to believe that it has regulatory authority, which it does not. And so maybe that is confusing in the title. And so maybe it does have a different title on it that really maybe reflects better what the intent of it is to be a body of all, the branches of government, excluding judiciary, and the public to really look at these difficult decisions and come together on some consensus of recommendations to move forward. So I know that I think the group would be totally flexible in looking at that if it needs a different title.
Mr. Chairman.
So, yeah, Senator Dockstader.
Well, let's see, you were called on Representative Ward to come right after.
I did, but you jumped on in.
Well, I'm wondering, we got a lot of questions here. This is a serious matter. I'm not ready to leave it alone yet, but at the same time, maybe we need to go back and find some answers here. What would our co-chairs think about laying this back? August.
I certainly think we're going to lay it back and I hear the same kind of 4 questions in a very broad manner that I think we're all hearing. And I don't know that we've done this very often, but would it be appropriate, Ms. Davis, if you had gathered the members of the current committee or a group, and then just maybe send an email to each member of the committee? And I think we all have similar concerns, but to really kind of flesh out those concerns, see if there are specific amendments that would make the bill more amenable, because I don't think you quite have the votes yet. I know we're missing 3 members, maybe 4. And I'm guessing I know what their thoughts are. And so, but getting into session right now with this without a higher comfort level of this committee. And I know there's some people here that want to testify, but I'm fairly certain it's the same kind of 4 arguments that you're dealing with. And so my recommendation would be if the governor's office would reach out individually, or maybe even a group, 2 at a time for an hour, and sit down with 4 people and say, here's the background, here's what we think the need is, here's why we think it's important. Because you're hearing, I'm hearing the same concerns. I have the same concerns. Is that a plausible thing the next 2 months?
Chairman Zwanitzer, absolutely. More than happy to do that with any of the members, all of the members, however you'd like me to craft it. Happy to do that. I'll pull some of the members together that have brought this recommendation forward, and we'd be happy to sit down.
Okay. And I certainly don't want to prevent anybody from speaking or who came to testify. And I know Representative Ward, you did have some more questions. If you want to ask them now, please do.
Thank you, Mr. Chairman, and I agree with your proposal. However, I don't think there's going to be any line of convincing that's going to convince me this is a good idea. I'm going to say that up front. I have 3 questions. The first is, I think Representative Hornak asked about a budget. I don't recall that I heard that answer. It's my first question. My second question is that we talked all morning about problems caused by overregulation, and how can a new bureaucracy help? I just don't see how it can. My third question is, and this may be a question to ask directly to the governor. I mean, no disrespect to you, Ms. Davis, but the question is, will members of the board be subject to removal for upholding the Hippocratic oath?
Ms. Davis, go ahead.
Chairman Zwanitzer, Representative Ward, I do apologize, Representative Hornak, I did forget to mention the budget. I think when we presented last time, we had talked about just 1 FTE for a director. Looking at what that salary would be for an individual, how we would classify them, would be that. I know in the draft bill now, currently, it also mentions in there travel costs for members if they are traveling. I think that is something we can also decide on for that. So I am happy to get for the August meeting some more concrete numbers to look at what an executive director position classification would look like, and bring some concrete numbers back to you, and get a little bit tighter on that with how the bill draft now reads. Happy to do that as well. As far as your second question about bureaucracy, I think we had a really great discussion earlier today about OB. And I think it kind of proved the point of the need for the OB subcommittee is really part of what this is, what we're talking about here, that has experts at the table that have an interest in this topic, who have all come together to try to find solutions, bring that to all of you. You all don't have the extensive amount of time to dedicate to that as legislators, but you can be represented in those conversations, and your chairman would always be part of that. So again, I think that plays into this issue. It's not a political bureaucratic position. It really is looking at how do we collectively bring voices together that are affected by healthcare issues across the state. And so, yes, it does add a position into government, but I think that it's well worth it if you get good policy that has been well thought out for moving forward. Your third question, as far as governor appointments, the governor takes his responsibility very seriously about board appointments. And if there is an area of any of the members on there that feel are not acting in an ethical way or can't, uphold their duties of being a member on that, then of course there's always the potential to be removed from a board. Again, the intent is that people act in good faith with being unbiased and being able to bring that to the table. And again, that is what this group would be. Again, different from some of our other boards who are governing. This is not a governing board.
I think there are still some questions while we're all here. So Senator Hutchins, I'm going to Representative Clauston.
Thank you, Mr. Chair. And Jen, I really do appreciate you, and I hope you know that. We've worked together, and I just think you're a wonderful person, and I hate seeing you in this position, but this is weighing so heavy on me. One of the things you mentioned was you want to put this group out to be permanent, so the next governor doesn't have to say, well, healthcare is not my priority. Maybe Yellowstone is blown up and that's my priority now. But guess what? We still have this healthcare authority we have to deal with. So I'm wondering about putting something on the back of the next governor, the next legislature, by us. We're creating something that we're saying, now Governor so-and-so, you have to deal with this because we've made this a priority for you. Healthcare is going to be your number one on your list. So I'm wondering how you feel about us taking on that task of telling the next governor or the next legislature that healthcare will be your priority, because it might not be. But if healthcare is so important as you're saying, again, why do we need to do this? Keep the task force running, doing what it does, and the next governor will take it up. Then I wonder, question number 2, which branch of government is going to be responsible for funding this new individual? Will it be the executive branch? Will it be the healthcare department within that branch? And I think that'll end my questions for today. Thank you.
Go ahead, Jen.
Chairman Zwanitzer, Senator Hutchings, thank you for your kindness. You are just fine. This is part of my job. So I appreciate your questions, and I appreciate the conversation. That's how we get to good things, right? Is having debates. So please don't worry about that. As far as looking at, gosh, now I've lost my train of thought. To your first question of what we need to, why we need to do this as far as giving a mandate to a new administration. I guess I don't see it that way. I see healthcare is a priority regardless of who is in office or who is in the legislature. We all have the need for healthcare, right? I don't think there's anybody in this room or anywhere that would argue that health and well-being of individuals is not important. How we get there, of course, is, debatable. But I think that healthcare is important. It's important not only for people to receive care, but again, it is a huge economic driver. And if we don't address healthcare, we have businesses who Wyoming is the highest for insurance premiums. So we have businesses who maybe don't want to come to Wyoming because they can't afford to offer health insurance to their employees because the cost is too high here. That's an economic issue. That's an economic diversification issue. This is a priority conversation that needs to continue about how we address some of those really important things. So again, I don't think that it is making this be a priority for an administration or a legislative branch as it changes. I think this becomes a Wyoming standard that we say healthcare is important and that we need to dedicate, an FTE to ensuring that this is always a topic that we're looking at. And whatever the current issue is, we need to dive into it and figure out how to solve it. So that's how I see it. I hope that answers your first question there. And then I'm sorry, tell me your
was on
second.
funding, on where the funding is coming from.
Oh, the
but
funding, where it's coming from.
We would appropriate as a separate operating agency, like the Energy Authority, I assume, isn't it
Yeah.
that way?
Yeah, and I think in there, one of the staff questions was like, where does this sit? And I think that is still up for some conversations. Do we put this like in A&I? Does it sit in the governor's office? I think that is what we also need to determine in that draft piece of legislation, which we could discuss further in August. Again, I think that it makes the most sense that it sits outside of the Department of Health agency because they need to be able to be an authentic player at the table because they are a piece of the system. So I think that if you have it sitting in A&I or, somewhere else where you can direct the appropriation to, I think that makes most sense. But again, I think that's up for debate with all of you. That is something we'd have to figure out from the legislative draft.
Okay, Reverend Clauston, you have a question still?
Yes, thank you,
Hopefully a
Mr.
question.
Chair.
Go ahead.
And Ms. Davis, I really value that we need Wyoming medical experts tackling our Wyoming medical problems, and our healthcare issues are going to be an ongoing problem. I appreciate the continuity if we do have some type of task or task force or board. I would change the name. I'm not happy with the authority part, but would we still have the governor's health task force? I guess what I don't want to do is be funding two different task force that are working on healthcare. So coming from the governor's office, would that disband the current task force and this would be the new experts in the room, or would we have both boards going forward?
Yes.
Chairman Zwanitzer, Representative Clauston, this would replace it. So if you all move forward with this, the Governor's Health Task Force would, give the work that they've been doing over to this group. Because currently now this has just been operating under myself, coordinating this for the governor and then working with our community partners and having them and current legislators here in the room, Senator Baldwin and Representative Zwanitzer have been huge members of all of the working group meetings. So this would just transfer.
Same thing, same people. They just have someone to corral them that's not you. That might make more than you do.
And a little different membership there.
Exactly.
Yeah.
All right, committee, the governor, Representative Yin.
Mr. Chairman, thank you. So if I may, I kind of want to make a comment and a question maybe to the other members on the committee. I've heard all these concerns and it does feel like we're going in a circle a little bit, but I'd be interested to know if other members of the committee would also be interested in repealing the Wyoming Energy Authority, because the same arguments that I've heard about this authority are definitely ones that you could use on the Wyoming Energy Authority. Why do we need it? Why is it important? Why should it have continuity across administrations? And I think for me, I think it's because it is important across administrations. Healthcare is important across administrations. Energy is important across administrations. So the question maybe should be to the committee, if you don't think healthcare is important across administrations, do you also not think that energy is important across administrations? And maybe we should just get rid of that one too, if we're not going to have this one.
That was a rhetorical question, correct? Okay.
Thank you.
As you can tell, we're getting a little punchy and it's lunch and we're not quite there yet. So that sounds like a plan of attack. I know there's some people, I kind of know what they're going to say. I do think we're going to go in a circle, but if you would reach out, I don't think you're going to change some people's minds. Hopefully, as legislators, we're always open to listening to comments and thoughts and working through the issue, but it's a conceptual idea. I don't know if amendments are going to make it more palatable. So we look forward to having you back in August, probably more on your home turf in the Capitol. And we will continue to see if there's desire in this committee to make it a committee bill.
Chairman Zwanser, thank you. I appreciate it. And committee, please know, I really do appreciate the comments and welcome them. So looking forward to having some conversations with you further on this. And it's good for us to also have an open mind and answer all of these questions that are concerning. So thank you. I do appreciate that opportunity.
And so we certainly can, I don't want to stifle public comment or debate. So I know Ms. Cartwright, you do want to jump in on this. Go ahead and say some things. Go ahead.
Thank you,
We'll
Mr.
give it
Chair.
one more second. I know you had your hand up, Jen. There you are. Go ahead.
Thank you, Mr. Chairman. Jen Cartwright, I'm a founding board member of Healthy Wyoming, a 501c3 statewide coalition that supports Medicaid expansion. I've also been a member of the Governor's Task Force since the beginning. It was an honor to serve as part of a cohort of experts who began providing guidance during the pandemic and then to additional glaring health issues. The task force, under Jen Davis's direction, discussed a full range of challenges, including EMS, access to care, and provider issues in our rural state. Jen polled the members on a regular basis about the important issues and realigned subcommittees accordingly. And members were volunteering their time to support the governor's office. The reason for sharing this is to speak in support of the healthcare authority that came as a concept from the governor's task force. I also sat in many healthcare commission meetings in the 2000s and found the data collected to be so important that my own organization at the time paid to keep the website up when the state was moving on. That data was attempting to provide information from much of the same challenges that are being discussed today. Unfortunately, domain name problems kept me from being able to show you the value of those data points and reports that were done in the 2000s, but it was valuable and it was important, but obviously it was under a governor and that's the reason it went away. So this discussion is really no difference. It's a forest and trees discussion, in my opinion. Having a group of people tasked to seeing the whole rather than the parts is a worthy effort. And finally, from my vision, the members at large are consumers whose voices are not heard in any specific way on this front. So having people who are in the throes of the healthcare system, I think are important voices for both the healthcare authority or whatever it ends up being named, as well as legislators. So thank you, Mr. Chairman.
Thank you, Ms. Cartwright. Any questions for Jan? Not seeing any. Checking online, not seeing any others jumping in. Anyone else for public comment on the healthcare authority who's here in the audience? Seeing none. All right, Jen, you have your marching orders. We look forward to seeing where we end up here and having you back in August.
Chairman, would you like me to coordinate that through the two chairs, or would you like me to just reach out? How would you like me to coordinate that?
I would like you to reach out to all members of the committee. It can be one group email to all of us or individuals, and we'll see who takes you up on the offer for more conversation.
Okay,
I would trust that the members of this committee who have concerns, who have any belief that it can be moved forward, would reach out and, yeah, have discussion with you on if it can be made better, or you can continue to answer concerns.
okay, sounds great. Thank you.
Certainly appreciate it. With that committee, you'll remember at our last meeting, Representative Clouston made a motion to have some discussion on placards for handicapped signatories. That apparently there was an issue, and there does truly appear to be an issue throughout the state on who can issue handicap plates for individuals and what level of profession they need to be. There's also an issue that was brought forth by a veterans organization regarding disabled license plates. And so it seemed to somewhat fit in the realm of what we were talking about already. And so I've also included that topic, and you'll hear some people here to wish to testify on that as well. So with that, Representative Clouston, do you want to kick us off on the problem? And I know we do have YDOT here, who are certainly happy to give us an overview, but since it was your request, maybe you could just remind us the issue we're trying to solve.
Yes, thank you, Mr. Chair, and to the committee. So the problem came up. We had a patient who, looking at the Wyoming laws, definitely qualified for the temporary placard. Patient had had surgery from a podiatrist, and a podiatrist in Wyoming is not able to write for or prescribe for the placard. Patient came to my office. We have physical therapists there who every day we test people to see if they can return to work, what their function are. And again, there's many things there that we test every day. I also had a physician assistant in my office. And again, they are not allowed to write for these either. So currently in Wyoming, only a physician or an advanced nurse practitioner can sign off on these. We spent several hours trying to find a physician that Friday afternoon who would sign off on this so this person could get this taken care of. So just started doing some research into what other states do, which states allow other professions to sign off on this, trying to make this just an easier process for our patients that qualify, and also trying to decrease the burden on some of our physicians. I can tell you in this case, when we finally got a hold of the physician, they told me to figure out what qualified the patient to get the placard, and then he signed off on it. So again, I think this is just a small area, but something that we can do to improve the lives of our patients that qualify for these placards.
All right. Thank you very much. And then we do have Ms. Zimmerman, Ms. Lopez from YDOT. One of you would like to take the lead and maybe just give us an overview of where we are right now, Ms. Zimmerman, when it comes to these issues. Certainly welcome to the Labor and Health Committee. You probably never thought you'd be testifying before this one, but we're certainly happy to have you. Go ahead.
Thank you, Chairman Swanser and members of the committee. My name is Misty Zimmerman. I'm the program manager for Wyoming Driver Services. Representative Clouston, I appreciate you bringing this to this committee. And actually, as I've been listening this morning, I'm thinking of ways that this committee may be able to help me in the future as well. So currently, right now, we are aware that the statute does limit who is able to sign off on the Wyoming placards. Truly, this becomes a policy decision for this body as well as the legislature. As we walk forward, and I provided you with the information about our surrounding jurisdictions and simply as informational, just to kind of give you that information so that we were aware of what's going on. As an agency, we have we want every opportunity to help the individuals that qualify for these placards. And so broadening this scope is something that as the committee works through it, we're more than happy to work with. I would make one small recommendation, and that is up to the committee as well, but that potentially we do have the authority in the statute to promulgate rule for this. And as we identify additional healthcare professionals in the future, it may be an easier process to update in a rule environment versus in a statute, but we stand for whatever this committee would like to do. And with that, I would stand for any questions.
Questions committee. And maybe just one, Ms. Zimmerman, do you know if most states handle this by rule or are they statutory? We got a little bit of information here on our surrounding states, but it might not be clear to me if it's in their statutes or if it's in their driving regulations and rules. Do you happen to know?
Chairman Zawanitzer, I didn't look to each individual state when I compiled this. Most of the information is actually on their application. So that's where the information was obtained for the information that I provided, but I can definitely look at that for you and get back to you with that information if you'd like.
Chairman Baldwin.
Thank you, Mr. Chairman. I would suggest that we need to address this in statute simply because what's currently in statute is the problem. And if y'all have the form in front of you, and the form and the statute are in conflict. On the form, it says medical professional. In the statute, it says MD and advanced practice nurse. So I would suggest that we need to correct that in the statute, as we've done several times in this committee for other things, such as death certificates. There's a number of things we've done through the years, but I would suggest that we make that adjustment in statute and just correct it, and then it's done, and we don't have to move on in the future.
And so, Ms. Zimmerman, I'm not asking for a policy position, but it would certainly be agreeable to have a statutory solution and then to have a bill drafted if that's what this committee wants to do for our next meeting. And then we could list specifically in the statute what level of providers do have this entitlement and what don't. Do you see any concerns with that from your end, is my overall question? From a non-policy level, but a functional, structural level of who you work with and needs to turn in information to you.
Chairman Zawanitzer, Co-Chairman Baldwin, I don't see any issue with that. I do agree that the statute, even if we would decide to go with allowing us to define those via rule, the statute itself would need to be updated to indicate that. So as we move forward, whatever this committee chooses, we would definitely be ready to make those changes as you see fit.
All right. Other questions for YDOT? Senator Baldwin.
Just one quick question for LSO, and if we could reference this back to, there's definition of healthcare provider several places. If we could review this statute back to the definition of healthcare provider somewhere else in the statute, is that possible? Or is that not possible here?
LSO, go ahead.
Mr. Chairman, I believe that is possible. It'll take a little bit of work to figure out which definition to use because I think it is used several different ways within statute, but we'd leave that up to your discretion once you see the bill too.
Okay. Other questions, committee, for YDOT while I have them? Seeing none, thank you. As well, I don't know, Ms. Lopez, if you had anything to add. If not, certainly appreciate your time being here. Public comment on this proposal. I feel like there might be a motion for bill draft in a second. Just want to make sure there's no other public comment. Not seeing any. Would anyone like to make a motion to this effect at this time? Go ahead, Senator Baldwin.
Thank you, Mr. Chairman. I would motion for a bill draft to correct this statute. And I would say that the bill draft needs to say healthcare provider as defined in whatever LSO finds. To that effect, and just simply make it a simple one-page bill to correct this and just keep it as simple as possible.
Okay, moved by Baldwin, seconded by O'Hearn. And then a question I have for you then is that our current definition wouldn't include a physical therapist, I don't believe. And so that's my concern on hitting the right categories. And so it may need to be expanded, but if LSO could look through various provider types, and there may have to be some decisions this committee makes in regards to the draft on what is and what isn't allowed.
Agreed.
Supervising. Okay.
Agreed.
Agreed. Any other discussion on this bill draft for our next meeting? Seeing none, all in favor of that motion, please say aye.
Aye.
Those say no. Perfect. Sounds like a win, and we'll have at least one bill draft for our next meeting. With that, committee, next up, disabled veteran license plates. Mr. Sweeney from Cheyenne is joining us remotely. And perhaps he could just give a quick overview of the issue and what this committee could do for some statutory language to solve the problem. With that, welcome, Thomas. Floor is yours.
Thank you. Can you hear me?
We can.
Perfect. I'll try to make this brief. Good morning or good afternoon, and thank you. As a young airman, my first assignment in 1982 was at Lindsey Air Station, Germany. The first briefings that I received were on personal security. Don't be the ugly American. Don't wear American t-shirts. vary your route to and from work. In other words, don't make yourself a target to terrorist groups. For 3 years, I was assigned there. We received weekly, if not daily, briefings on potential targets. Fast forward to 1999, I'm deployed to United Arab Emirates. I was responsible for travel to the base to the city of Al Dhafra to pick up the phone bill and the second week of each month, and then to deliver the payment the first or third week of the month. Again, we were briefed to keep our eyes open for potential threats. Park away from other vehicles, check your vehicles when returning for IEDs or other bombs, and all the other things I learned in Germany 17 years earlier. This past year, due to the PACT Act, my disability status was increased to 60%. Among other benefits, I was able to receive a vehicle registration at a reduced fee as the taxes on one vehicle was waived. I was told at the time that the only plates I was eligible for were the disabled veterans plates, DV plates, or the service plates for the branch I served in, the Air Force, or AF plates. I wanted to keep the plates that I had, but was told the only way to get this benefit was to take the DV or Air Force plates. This concerned me, as now with a disabled veteran plate, that I could be taken as an easy target for a mugging or a strong armed robbery or some other crime. The other thought that I had also was someone may make me a target with my Air Force plates for political or other reasons. The third option, which I considered, was not to take advantage of the benefit that the great state of Wyoming offered me. I chose to have the Air Force plates. My request to this committee is to consider champion disabled veterans to receive the benefit that you graciously offered us by allowing us to use the standard plates. Please understand that this is my opinion, and I don't speak for any other of the thousands of veterans in the state of Wyoming. Thank you for your consideration.
Thank you. Questions committee. So ultimately, right now, from what I understand, and we'll have YDOT talk in a second, is that if you want the exemption as a disabled vet and that plate, which we don't charge you taxation on, you're required to either have the DV or the Air Force on the plate. You can't keep your current plate. And, we have a lot of places in Wyoming, like in Sublette County, where every plate here is a 3-number plate and people are very proud of their number. So questions? Representative Penn.
Thank you, Mr. Chairman. Mr. Sweeney, are you aware of any situations that have occurred in our state or others where people have been targeted because of their plates?
Mr. Sweeney, if you know.
No, ma'am, no, I am not. It's interesting that when I've been in other states, I've had several people come up and say, "Oh, you were in the Air Force. What'd you do?" Things of that nature. So I at this time I have not felt a threat, but I haven't been in Chicago or New York or any of those other places with my vehicle.
Other questions? Okay, not seeing any. Misty from YDOT is still on. Anything YDOT has to add on this? Or Debbie? Welcome, Ms. Lopez. Floor is yours.
Hello. Good afternoon, Mr. Chairman and committee. YDOT just keeps a database of all the customers who have DV status because the counties aren't linked in any way. So we would just need to somehow expand our database so that we would know that the person is only getting one free plate. So, I think we could probably work with IT to figure that out.
And it is, from what I understand, it's in statute that way. When I've read the statute, it does seem to say that they're required to get a disabled plate. So it does need to be a statutory fix.
Mr. Chairman, that's correct. They can get the standard DV, and then further down in the statute, it allows them to get any military related plate that they are also eligible for.
Okay. Questions for YDOT? Not seeing any from anyone. Or Senator Hutchins, do you have a question?
Mr. Chair, I did, but I was just a little perplexed at Mr. Sweeney's comments. A household with 2 veterans. We've traveled to every state or the lower 48 with our vehicles, DV plates, and we have never had an issue. It is more you find people more proud and commenting on your service. So it seems kind of I don't know, I'm not going to say odd, but it's interesting that Mr. Sweeney would feel that he may be under some type of threat for having the disabled veteran plate when we have so many people with handicap plates, placards on their plates, that I don't know if they feel threatened at all, but it's a matter of pride. So if I have Mr. Sweeney right, he wants to get the exemption but just have a regular plate to ask a question. Is that correct?
I
Senator
believe that is
Hutchins.
correct, Senator Hutchins. And go ahead. He is speaking on behalf of a group as well, so it's not just him specifically. But go ahead, Tom.
So I can't say that for the group, I'll be honest with you. This was my concern that I brought to my local legislators. And I know Chairman Zawante through another organization. And so I just expressed my concern that specifically with a disabled veteran plate that potentially could make you a target. This comes from my my experiences in Germany or Aldafra with us having to take elevated precautions. And no, I don't. I'm extremely proud of my Air Force plate, and that's the plate I chose. But I chose it over a disabled veteran plate specifically because I didn't want to be identified as a potential target being a disabled individual.
Okay. Other questions, committee? Representative Yen.
Mr. Chairman, thank you. Mr. Sweeney, I just want to try to get in my head what the concern is here. So the disabled veteran plate has no special fee, but the veteran plate has a fee, and so maybe from the chairman as well, could I get some clarification on what the exact ask is here?
So the statute right now says, as a disabled veteran, you're entitled to 1 free plate on a vehicle. But as part of that statute, from what I understand, Representative Yen, it basically requires you in the statute to get a DV on that plate saying publicly that you're a disabled veteran. Further down that statute, it also, and I wouldn't say it conflicts, but it somewhat conforms that if you were a member of your branch, you were allowed to get AF, Armed Forces, on that plate or your branch instead of the DV. And so that is kind of the way around it. If you don't want the DV, you do have to specify the branch and have AF. You just can't get a standard Wyman license plate without that insignia on it. And so I know there are some people who are, would like a vanity plate or have a long-standing multi-generational small low number plate. They're not eligible for that exemption unless they get a certain kind of plate. And I think that is where I've also heard it's coming from other individuals. So some people don't want to be targeted as a disabled veteran, or they feel like it, some people are very, I don't want to speak for all people, but that's the statutory issue right now, that you're required to get certain letters on your plate if you want this exemption. Other questions, committee? Anybody else online wish to testify? Anybody in the audience? Sir, come on down. Welcome. Just state your name and who you're with and what we need to know.
Yes, sir. My name is Staff Sergeant Joseph W. Waller, retired United States Army. Thank you, Mr. Chairman. I apologize for my decorum. It's horrible. So senators, representatives, thank you very much for having me. Thank you for hearing my voice on this. I do understand Mr. Sweeney's issue as a veteran of being a target. I tend to go the other direction. With that being said, I feel that if this committee chooses to do so, I think it would be a very good idea just to put a military veteran at ease in their own mindset with doing a standard Wyoming plate, just for their for their operational security ideas that they have in their own minds. Me, on the other hand, I'm very proud of my service. I'm very proud of my disabled veteran status. You go out on my truck right now, you'll see my disabled veteran plates. I have traveled across this country many times with my disabled veteran plates, and I have never experienced anything that Mr. Sweeney is alluding to that could possibly happen. As the senator up on the screen had stated earlier, that if Yellowstone erupted, she was making reference to another thing, and I kind of caught that funny with the what ifs in life. Me as a veteran, I walk around with my head on a swivel. I'm constantly watching and looking and observing of what's going on around me. My surroundings are very important to me. Having the disabled veteran plates, I don't think that puts on me an additional precaution that I have to do as a disabled veteran. In fact, much with what the senator also stated was with family members, that she gets nothing but the pats on the back, the attaboys, the kudos. Thank you very much for your service, sir. Appreciate it. And that's what I've experienced. Not everybody experiences the same things in life. Not everybody reflects back on life in the same way. I spent 4.5 years in the infantry, 5.5 years military police corps. 3 years of that was protective services. I was assigned to protect people like Mr. Sweeney when he would have to go and do pay things. You dress down, you do everything you're supposed to do. If you're going to Chicago, you're going to dress like somebody from Chicago. You're in Wyoming, you're going to wear a gun on your hip. I mean, no offense, but that's the way it goes. You're going to blend into your surroundings. So with that being said, there's tens of thousands of veterans across the United States, disabled and just those that got lucky and didn't get injured. You see disabled vet plates all over the place. I have, in my experience, I have not at all had anyone swerve at my vehicle, spit on a windshield, any of the things that Vietnam veterans had to go through when they were coming back from their service. There's a pride in the United States still for service members and for the service that they've done for our country. And there is one change I'd like to see, though, with the license plates, seeing now we're on the topic. State of Arkansas issues plates. They issue one disabled vet plate that is the free plate. Okay. Now it's not free, mind you. When you purchase a vehicle, you're still paying the taxation of that vehicle. Then you get your plate for free. Then every year after that, there's no taxes on that vehicle. However, you're also authorized your branch of service plate. And according to your DD 214, you can receive, like for me, an Afghanistan plate, an Iraq plate. There's a myriad. There's 6 plates that I qualified for in the state of Arkansas, besides the disabled veteran plate that was free. Wyoming does not do that. They just do the branches of service and the disabled veteran. With that being said, I'd kind of like to see, maybe for us guys that want to take a little pride in what we did in the desert, just to have that on a plate. But other than that, Mr. Chairman, senators, representatives, I appreciate your time in this, and thank you very much for hearing me.
Thank you. I don't go too far. Representative Clauston, you have a question?
Yes, thank you, Mr. Chairman, and thank you to you. Thank you to you and Mr. Sweeney for your service and your testimony, taking the time today to bring something that's important to you. If anybody deserves to get to pick whatever plate's on their vehicle, it's a disabled veteran. So you have my full support on making some changes. My question would be to Ms. Lopez. Debbie, what kind of cost would it take to make this change that the veterans can pick whatever plate that they want to put on their personal vehicle?
Ms. Lopez.
Mr. Chairman, Representative, I mean, I'm not sure if there would really be a cost. We just have to have our IT department do a little bit of programming, so in-house costs for that.
Okay. Other questions or follow-up? Go ahead, sir.
I have a quick question, for Ms. Lopez, maybe she can answer that. Are the plates, the disabled veteran plates, the armed forces plates, are those partially funded or funded by the Veterans Administration as far as approval for that item?
Ms. Lopez, do you know the answer to that question?
Mr. Chairman, I mean, I'm not sure what you mean by funded, but there's a $50 fee for just the standard veteran plate. And part of that is a YDOT fee to make the plate, but then part of it goes to the Veterans Commission and they use that money to make pamphlets and I think, you know, advertise their services.
We give
Does
money
that
to the
answer?
feds when it comes to license plate, money to us, correct?
I'm sorry, I apologize. What was that question?
The overall question is, do we get any money for license plates from the federal government? Or is it all in-house in the state that pays for all of the plates?
Mr. Chairman, no money comes from the feds. It's all in-house for the plates.
Other questions? Are you here locally in Sublette County and came to visit us?
Negative, sir. I'm actually from Lander, so
Oh,
I had a little bit of a drive this morning. I apologize for being late, but
perfect timing, just 60 miles away in 2.5 hours. Yeah, but we certainly appreciate you coming in person. It's always nice.
yes, sir. Thank you.
You're welcome. All right, committee, anybody else? I don't see anybody want to request a bill draft for our next meeting? Representative Yin.
Mr. Chairman, I'll make a motion for a bill draft to allow disabled veterans to get specialty armed forces plates for free and not have to choose just a disabled veteran plate for that. Does that make sense?
Would it just be either or would it be if they want a standard license plate as well? Or do they have to take something that identifies them at least in the service?
Mr. Chairman, is there an additional fee for a standard license plate? Or I thought that was just the regular registration fee to get to the standard license plate?
From what I understand, it's really about a cost. To get the free plate, it has to currently now be either an armed forces or a DV plate. And so the question is, can a disabled veteran just get whatever plate they want on their vehicle, or do they have to have AF or DV on it? And that, so if you'd rephrase your motion.
Sure, Mr. Chairman, I would include that into my motion.
Second.
Seconded by Representative Ward. Yeah, it's nice. Any discussion, committee? If not, if this motion passes, Ellis will draft a bill for our next meeting in Cheyenne to further discuss. All those in favor, please say aye.
Aye.
Opposed, say no. That motion carries. We've gotten through our agenda. Is there any other public comment on anything before Labor and Health and Social Services? Come on back, sir. I'm not seeing anybody online. But anything else you'd like the Labor and Health Committee to know or pursue? Floor is yours.
Well, hopefully I'm at the right committee. I've had experience with the Department of Family Services, with some issues that have happened. I'm sure you all are aware that the system seems a little broke in places with it. I'd like to give my story, but I don't have a lot of time with it. So what I'll do is I'll try to condense this greatly for you. Unfortunately, Department of Family Services does not work for the family. It seems that it is a bit one-sided, lopsided, especially when there are allegations that are made and the follow-ups to those allegations. There's no accountability for an individual that keeps making the same false allegations against numerous people each time. The system seems to be, I don't want to unfairly say this, but rigged towards a gender. And I say that with my personal dealings. I'm now on my third divorce. And each time I have been isolated from my children. I've not been allowed to see my children for 6, 7, even a year. And by the time I get to see my children, the parental alienation that's being allowed to be conducted by DFS, particularly in stating that you are a danger to your children by stating a simple fact of you are a veteran of the United States military. And because I am a veteran of the United States military, I am deemed a dangerous individual. Unfortunately, that stigma is true to a certain extent. I am a very dangerous individual. I am a disabled veteran, and I not take anything away from Mr. Sweeney again, but as crippled up as I am with the 6 inches of titanium rod in my back, the other disabilities I have, I'm pretty sure there's not a person in this room that could take me if the situation arose. However, with my military training, I was also taught patience, was taught when to allow my anger to arise and allow me to do certain things. I am a very peaceful person. I'm very, I'm a pacifist by nature. I don't like fighting. I don't like screaming. I don't like yelling. The situations do arise, and I understand that. But with the situations that I am experiencing, it takes an accusation from a spouse to DFS by saying that Mr. Waller, I'll use my example, Mr. Waller has beat his children. He's done these things, and he's a horrible, horrible person. And that's able to be weaponized, taken to court, presented to a judge, DFS stamped off on it because, well, yeah, we're investigating it, but because they're investigating it, now all of a sudden I have a problem with the judge because the judge is looking at me like, well, DFS isn't going to investigate anything unless DFS knows there's something else going on. However, when there's photographs and things of abuse going on with children, where I've presented it to DFS, nothing is investigated, nothing is conducted properly. When I ask for any kind of a record for it, I'm denied those records. I'm being told by DFS that you didn't fill the paperwork out properly. Then when I get it filled out properly, because I have an attorney fill it out for me, they submit it to DFS, and DFS then goes and says, well, this is outside your scope. You don't need this as dad. I'm sorry. I apologize. However, this is something that is plaguing divorces, plaguing fathers in their relationships with their children, with mothers, with their relationships with their children as well. It's not just men, and I'm not trying to focus solely on men, but it seems to be more prominent where the spouses, the female spouses are allowed to do this thing and it goes unchecked. And I've heard of cases where a judge says, hey, this has happened before and happened before, investigate it, go after this. And a prosecutor goes, I'm sorry, we're not doing that. Because we want these women to come forward and say these things that, if there's wrongdoing. And I understand that wholeheartedly. I am all for it. On the other hand, when you are accused of something, and I don't know if you ladies and gentlemen have ever been accused of anything, but when you're falsely accused of something, I'm sure you're in politics, you've been accused of a lot of things falsely. With that being said, then you're on the defense and you're having to defend yourself against something that you feel that you should not have to defend yourself against. It should be something where, hey, check my record, check how I voted on this, check how I am with this. Look at police reports, look at these things. But on the other hand, that's not being done. That's not being conducted. And I'm sure that y'all get frustrated with the news, not correcting their stories, not doing what they're supposed, doing their due diligence to find these things out before it's presented to the public, and then you're under public scrutiny. And that's what I've been dealing with for the last 6 months on this divorce, is that I have been unable to see my children, and it's all been, well, spouse led, but DFS as the tool that's being used to stop me from being allowed to even talk to my children on the telephone now. It's horrible. It's a horrible, horrible experience. And I would love to sit down with you. I have records. I have everything to present, to have any kind of a conversation. I have reached out to representatives. I have reached out to senators. And Miss Penn had actually invited me up to come. And I was actually going to be up here yesterday, but unfortunately I was unable to make it. To talk about DFS and talk about what I see as broke with DFS. Do I have a fix for it? Of course not. This is something that would have to be checked out, investigated, and figure out what's going on, why this happens, why a father can't go into DFS and say, hey, I need this report of child neglect, child abuse that had occurred, and I need this copy so that way I can take it to court. But
so committee, we tend not to go into local level issues, but certainly at our next meeting, we could have DFS give us an hour on their processes, on their number of complaints, on how often those get resolved, and what the parameters are around during a complaint, having each parent access to those kids and during an investigation. I'm just trying to, at a statewide level, it's difficult to delve into a local situation, but we haven't really had that level of scrutiny on DFS outside of the daycare realm in the last 2 years of this committee. So if there's time on the agenda, co-chairman, I don't think it would hurt to invite DFS in and just say, you know, there's some turmoil in the state when it comes to these. And I think it would be really enlightening to the committee about the number of cases and how these work. As a foster parent who does emergency care, I get, you know, the weird calls saying we just need to leave these kids with you for 2 days while we investigate this. And sometimes it's 2 days and sometimes it's 2 weeks.
Mr. Chairman.
Yep.
And
Go ahead,
have them
Senator.
report how it's done individually around the state, how they address it, not noting individual cases, not reporting names, but how do they address this around the state?
Because we certainly should make sure it's consistent. And if there's field office numbers as well. I'm confident someone from DFS is listening in right now, getting all this. So they can be prepared to come testify at our next meeting. Go ahead, sir.
well, and I have another interesting point. When you go into lodge a complaint with DFS, there's no paperwork to fill out. They don't give you any paperwork to fill out. They just say, okay, yeah, well, I'll let so-and-so know in this office and let them know what's going on. And I've dealt with 4 different DFS offices around the state. It's not just in the DFS office in Lander or Riverton or Thermopolis, or in Commerce County. It's with one, it would be one thing, but when there's 4 different offices that are giving you the same issues with different incidences, and you're trying to get the information and trying to get these things done, believe it or not, I had a full head of hair 7 months ago. Don't believe that, but anyways, with that being said, it's mind-boggling, and it's very stressful, and not knowing how to proceed any further, because there is no form for me to fill out, or if there is a form, I'm being denied that form also. So if I'm being denied that form, then there is a systemic issue going on that needs to be addressed and dealt with. But
yeah, I know most of their reports come from law enforcement. They're required within a certain period to investigate. We will certainly ask about their process for people who come in and make a allegation. Representative Hornock, do you have a question? Go ahead.
Yeah, I do, Mr. Chairman. Thank you. Not necessarily a question, but to add to what you said about DFS reporting to us in our next meeting. It sounds like from the testimony we've heard, it sounds like there's a possible disparity between genders, parental males versus, fathers versus mothers, and how the kids are divided. I'd like to hear some more information about that statistic from DFS, and specific to this testimony we've heard, status or statistics on military service or veterans, and how that relates to where children are placed as well.
Leighton, or you could check with DFS and see if we could run some information and numbers, and see if there is kind of any categorical things on members of the military, on their rates. I don't know if they track that specifically, but I certainly know they do through the judicial system. If it's a current active member of the military, I'm not sure about veterans, but I think we can have DFS give us as much information as they can in that realm. Other questions, committee? Not seeing any, but I don't know if you're going to be in Cheyenne at the end of August, but we'll certainly have it online as well. And check in with DFS and have a better understanding of their process and reporting, and if there are statutory changes, right, that we can encourage, we would certainly do that. All right, thank you. Any other public comment to come before the committee today? Seeing none. Our next committee meeting will be in August 29th and 30th in Cheyenne. Been lovely driving to this part of the state twice. That's what I hear. And so there's, we do have some leftover, 2 other topics from the Department of Health they're still working on that this committee has asked for. And I don't know if we have anybody who wanted any other bill drafts at this meeting for any other research for our next meeting. Certainly happy to entertain them. Representative Penn.
Thank you, Mr. Chairman. I'd like to motion that we draft a bill to address tort reform, possibly looking at Texas law that has been passed in previously.
Second.
Is that a constitutional amendment?
Constitutional amendment, yes.
Okay, discussion committee. All those in favor?
Mr. Chairman.
Senator Doxeter.
Are we using only Texas in his example? Are there other examples we could tie in so we're not limited?
Representative Penn, does it have to be Texas?
I would be agreeable to reviewing other, I do know of Texas legislation that has passed, and we heard some today. I don't think we need to restrict it strictly to Texas, but my main goal is just that we get something in our hands next meeting that we can take a close look at, and specifically addressing our constitutional issue. It sounds like 2004, we have, previous Wyoming model legislation for that as well. So.
Okay. Other questions? All in favor of that motion, say aye.
Aye.
Opposed, say no.
No.
It sounds like that bill draft, as far as LSO, you think we can get some kind of bill draft on a tort reform constitutional amendment by next meeting? Yep. We didn't ask too much of you, so the next 2 months, so that should work. Anybody else? All right, not seeing anything else come before the committee. Everybody have a safe drive home, and we'll look forward to seeing you in Cheyenne in August in about a little more than 2 months after the election season. With that, we are adjourned.